more can be achieved if the problems are prevented than just getting more people to treat the problems. That was when the decision was made to spread the news of how to prevent the problems rather than just treating the problems. And in the area of infertility, I'm the current of the Ghana Fertility Society. I'll be handing over soon. And yeah, so we'll talk about the link between infertility and infectious diseases, then touch a bit on male infertility. Good. So with a man and a woman meeting to have a baby, there are three key things that are required: good sperms, good eggs, and a good tube where the egg and the sperm would meet. So infections can affect sperms, eggs, or the tubes, particularly the tubes. So generally, where's my pointer? Yeah. So generally, the egg is released from the ovary midway in the cycle, usually 14 days. And the sperm comes from the vagina into the tube. This is where fertilization takes place. So anything that blocks this channel means infertility. In fact, the first IVF baby born was because the mother's tubes were blocked. Okay. So what's infertility? When a couple are together for a year and they have regular intercourse. What is regular intercourse? So about 3 times a week. And still no baby, that's infertility. It can be primary if the woman has never been pregnant before, or secondary if she's been pregnant before. Then the prevalence, you can see the differences. In the United Kingdom, for instance, it's about 6%. In USA, about 10%. Sub-Saharan Africa, 20 to 30%. Then Southeast Asia and the Oceania, 19 to 27%. And who are responsible for that? If you look here, 40% of the time is purely the man. Another 40, purely the woman. 15%, both male and female, in the ratio of 50-50. And then 5% is unexplained. So half of the time is the man's problem. Now, in the developed countries, infertility may be due mainly to these factors: endometriosis, anovulation, that's difficulty with releasing eggs, or hyperprolactinemia. Prolactin is a hormone produced by the brain, or premature ovarian failure. The highest causes are from sexually transmitted infections, or post-abortal infections, or puerperal infection, which is infection after having a child, or which will lead to tubal occlusion. Yeah, so that's the tubes get blocked. So blockage of tubes is a major factor in the developing countries. And why do we say that? Because we find that several studies have shown higher levels of infections in infertile females compared to fertile ones. Okay, so when you get infections, this is what happens to the tubes, and so it affects transmission of the egg. So infections are associated with unsafe abortions leading to tubal blockage from infections. Asherman syndrome is when the woman has so many curettage or abortions with scraping of the lining of the womb to the extent that the whole lining is taken off and the walls of the womb stick together. So these women typically will present with having no periods or very scanty, painful periods. Only few women in developing countries obtain care from trained personnel at delivery. It's very true because the health resources do not allow for a fair distribution of proper health institutions across the country. So the majority still rely on traditional birth attendants or even churches where non-sterile procedures are practiced. This results in very high pelvic infections after delivery. Yeah, in addition, because of the poor health resources, you find that some women remain in labor for very long. They're doing everything possible to get them to deliver, and it doesn't until sometimes complicated by pelvic infection, because you have to keep examining these women over and over again. It can result either in maternal death or severe tubal damage or obstetric fistula, which is leakage of urine or feces because the head had been in the pelvis for so long that it's stopped blood supply to parts of the vagina or the bladder or rectum. So you get a hole there, which continues leaking this, and this brings infections and makes them infertile. Other infections like tuberculosis, schistosomiasis, which is very common in the developing world, also damage the endometrium and the tubes, leading to infertility. Then the practice of female genital mutilation is usually associated with complications of infertility. This is a subject on its own, but very common, especially in the Muslim sect in Africa, Asia, and the Middle East. Yeah, so one of the messages of Merck Foundation is that looking at the data and the statistics, which is 50-50, we need to share the journey of treatment together. That's the man and the woman. It can affect not only women, but half the cases are due to men, and it's the commonest conditions affecting reproductive age group between 20 and 45. Get informed, support your wife, get tested with your wife. The usual thing you find is when a couple are infertile, the woman is sent to the hospital, and it is her fault because she's the one to get pregnant, irrespective of whether the man is infertile or not. So a man may change wives 3-4 times and never have even tested his own sperm. If he's fortunate, or is that unfortunate? The woman may pass the buck. Yeah. So a little bit about male infertility before we go on. What is male infertility? This is the inability of a male to make a fertile female pregnant after a minimum of at least 1 year of regular unprotected intercourse. And what are the common causes? In the developed world, the most prominent causes for male infertility are hypogonadotrophy, hypogonadism. These are all big words, but it's to do with mainly the hormones that control sperm production and fertility. That's another of the hormone, or testicular failure. By contrast, in sub-Saharan Africa, sexually transmitted diseases, especially by gonorrhea, chlamydia, etc., account for the significant proportion of cases of male infertility, leading to chronic epididymitis, occlusion of the vas deferens, and low sperm count, or no sperms at all. Yes, next slide. Yeah, so normally, just the same way as hormones from the brain control egg production in a woman, the same thing happens in a man. But in the man, the testis represents the ovaries, where the eggs are produced in the woman. Here, the sperms are produced. So the hormones from the brain work on the testis, and the sperms are produced in the testis. They travel through the vas deferens, through the back, get additions from the prostate and other glands before it comes through the penis. So anything, any infection here, which blocks the vas deferens, will make the man infertile. Yeah, other causes, infective causes of infertility are mumps. This is normally in the teenage years. You find a huge swelling in the angle of the neck. It has so many different names in various languages. Sometimes it's thought to be a sign that you are getting into puberty. In my part of the world, they paint it white and put certain dots on it. But when you get that from the virus, mumps virus, it tends to affect the testes as well. And if it's severe enough, it would make you infertile. Other causes in the male would be during hernia repair. If you look back at the, this tube from the testis at this point actually goes through where the hernia orifices are, very close to that point. So when a man gets a hernia and it's not done properly, the vas deferens is injured or cut during that period. And so if you end up having hernia twice, you may be doomed if it's not done properly. Or in men, if you have a male child born and the testes do not descend for a long time, the functioning ability of the testis is destroyed. And so that kid may be infertile if it is detected too late. And if it's kept even much longer, you can end up getting cancer of the testis because of that. Varicocele is when you have a lot of varicose veins in the scrotum. What happens is the varicose veins increase the temperature of the testis. God in his wisdom put the testis outside the body, unlike the ovaries being inside, because they function at a slightly lower temperature to the body temperature. So if you have your testis in there, it affects the function. Other causes of infertility, the man may have very good sperm count, but if he has premature ejaculation, sometimes it's so premature, even before he can get in, the sperm is out. Or if for some reason you have infrequent sexual intercourse or erectile dysfunction, all that can affect fertility. Other things, alcohol intake that affects your sperm production, drugs and smoking, equally the same. So all out, we must be advocating for reduction in these things. Yes. Sometimes people feel if you take some alcohol, it will give you some confidence to be able to perform, but you're rather weakening your sperms. Yes, remember I spoke about temperature, why the testes are outside the body rather than inside. And therefore, even if your testes are well descended, but you expose yourself to too much heat, it affects your sperm production. So that also would make you infertile. Yeah, it's a major cause of marital disharmony in Africa, exposing women to ostracization, social discrimination, physical violence. You heard of all that. In India and South India, for that matter, infertility has significant negative social impact on the lives of the infertile couple, particularly women, who frequently experience violence, divorce, social stigma, emotional stress, anxiety, depression, and low self-esteem. Yes, how do we prevent this? Since the major cause in sub-Saharan Africa, if you look at the causes, is from pelvic infection in both the male and female, it is clear that a better approach to its management is directed towards programs of prevention to the higher authorities. I wish the first ladies were in here because they can tell their husbands where emphasis must be laid. And that is why Merck Foundation has been very strategic in getting first ladies involved in this drive. Yes, then secondary prevention. This involves the recognition and aggressive treatment, because you couldn't prevent it, it's happened. So you have to aggressively treat sexually transmitted infections and post-abortal and prepubertal sepsis to prevent infertility. And for it to be done properly, as much as possible, go to a health facility. You can just go to a pharmacy and pick something, but every antibiotic does not kill every infection. And so get things done properly. Do not self-medicate. It's better to get it right the first time than to be sorry. Then the tertiary level of prevention is to use methods to mitigate the effects of infertility when it's already happened. This is where you need to do systematic counseling with conventional methods, where cost is not a problem. Then the use of the newer reproductive techniques, because at a point, if the tubes are totally blocked and you can't open them, then it means that you need assisted reproduction. And this is not cheap anywhere in the country, in the world. Apart from that, it's not even available everywhere. Where infertility is irreversible, counsel couple to accept their fate and consider options of adoption or fostering. Okay, these are some of the fertility management options. Controlled ovarian stimulation with timed intercourse. All you may do is just give the couple some medication so the woman can have more eggs at the time of ovulation, because 97% of women release one egg a month. 97% in the whole world. There are a few places like northern Nigeria where, it's thought because of their food, maybe a yam or something, there's a higher number of eggs released per month, but 97% of people release one egg. So anytime you give women medication that gives them 2 eggs, 3 eggs per month, they become more fertile. So you do that, and then you may give medication to release the eggs and tell them when to have intercourse. Or if the man's sperm count is a bit low, you may prepare and select the good ones and then put them through the tube, which is called intrauterine insemination. Or if it's beyond that, you may have to do the in vitro fertilization, where you get the eggs out, fertilize them, and then put them in. Sometimes the sperms are so few and so weak that even if you bring the eggs to them and put them there, they still can't perform. In those instances, you have to inject the sperm into the egg. That's the intracytoplasmic sperm injection. And at this point, because the 2 DNAs have come together, fertilization is much better, and then they develop. At that point, you go into the testis, either by needle aspiration or you do a little incision and get the sperms out, get the woman's eggs, fertilize it, and put the baby in. There are times that the woman's or the man's sperms are totally destroyed, but you want to help them. So you get gamete donation, either sperm donation or egg donation. If the woman's circumstances are so bad that womb cannot carry, then you get a surrogate who will carry for them. Beyond that, there's also the opportunity for adoption or fostering. Yes, so public awareness and health education is very, very important. HIV is still available, it's still around, it hasn't been eradicated. Those who are behaving well are living with it, very, very healthy, some of them healthier than you and I in this room here. However, it affects the body's immunity and can affect the body's ability to produce the hormones that are required for pregnancy. It may also lead to premature menopause. So safe sex is important. Yeah, chlamydia and gonorrhea are very notorious sexually transmitted infections. So safe sex. Safe sex. Yes, needle sharing is another way of transmitting HIV and some other infections. So hepatitis and the rest, so try avoid that. Smoking, quit tobacco. It's amazing that despite the whole world knowing of how bad tobacco is, because of the money that it yields from taxes, countries cannot stop them because they make money from it. It's a big shame. We have to keep working on that. Yes, eating well is important. When you're extremely underweight or extremely overweight, that affects your hormones and the functions that help with fertility. And so you become less fertile when you're underweight or overweight. So try and be the right weight for your height. Yes, coffee is also known to affect fertility, particularly in women. So if you're trying to have a baby, less coffee. So what are our key take-home messages? For Make More Than a Mother, infertility is not a stigma. It can happen to anybody. Some people are born with some genetic problems that make them infertile and need our support. It affects men and women equally. Now, you've been informed. I know there are many questions out there, and I enjoy the Q&A more than any other time. Spread the word. Support your wives. Wives, educate your husbands and support them. It's a shared responsibility. Thank you very much for your attention. Thank you very much.
Thank you, Dr. Edem, for sharing such a valuable information with us. The second speaker for the day is Professor Dr. Justin Boloko-Esimo, Head of Reproductive Medicine in the Department of Gynecology and Obstetrics, Clinics University of Kinshasa, member of Board of Trustees of African Reproductive Care Society from Democratic Republic of the Congo. Dr. Justin will highlight for us the fertility management options as the messages for the community. And we will be having a French translator who is going to assist Professor Justin during the presentation.
I think that I will speak, my English is very good. So I try to speak in English and in French. First of all, I noticed that Dr. Amzin have taken also all I was prepared to talk. So I think that I'll add something in his presentation, and so we can continue. Please, the management of the couple of infertility. The problem is that before to manage the pathology, you have to know the physiology, the anatomy, and also the cause, the main etiology of this pathology. Dr. Amzin have given the etiology and also the anatomy. But that I can say is to give some particularities of infertility in South Africa. The problem is that, as we know, most of the time, people believe that the problem is the problem of the women only. But with the explanation, we notice that the problem is shared among the men and the female. For the management of infertility in our area, we have some pathology in sub-Saharan region, the problem of obesity. Obesity, we notice that many women around in our country, we have almost 30% of women with a problem of obesity. And obesity is a problem of infertility with it disturbs the hormonology and also the produce oocyte is disturbed by the problem of obesity. And another problem is the problem of abortion, unsafe abortion. Apart from the contraceptive method, we have many cases of unsafe abortion with the complication like carcinoma and also the blockade of the tube. But to take care of infertility, it has a cost. It costs a lot. So people are poor. Most of people are poor. And also the problem of the quality of the treatment. Assisted reproductive medicine it costs a lot. There is no insurance, medical insurance for many countries in South Africa. So that many people can't afford the treatment, the relevant treatment for infertility. Thanks to Merck Foundation, we have trained many doctors in our area who can use the assisted reproductive technology to treat the problem of infertility. But the problem is there, the problem of affordability of the treatment of assisted reproductive technology. So we can say that if you see in our slide, for the treatment, we have the treatment of the problem of infection, who is the main cause of infertility in our region. The problem of sexually transmitted disease, the treatment, antibiotics. For the men, antioxidant and hormone. Why antioxidant? Because for the male infertility, many of the causes are what we call the reactive oxygen species, qui sont utilisés dans l'assistance médicale à la procréation. Ce sont des médicaments qui sont peu accessibles à la population. Et le tout, c'est au niveau des pays. Il y a beaucoup de priorités. Dans nos pays, il y a des priorités de problèmes de malaria, de problèmes de HIV, de problèmes de guerre, et ainsi de suite, ce qui fait que les gouvernements ont des priorités qui les poussent à ne pas prendre en considération tous les traitements qui concernent l'infertilité. Donc, c'est un problème d'accessibilité au traitement de l'infertilité. Et si nous pouvons résumer le traitement, nous avons deux groupes de traitements qu'on utilise pour le problème d'infertilité. Il y a des traitements pour refaire l'anatomie, soigner les cas. Et il y a l'autre volet de traitement qui est le traitement avec l'assistance médicale à la procréation où on manipule les gamètes. Et nous venions de le dire, quand nous parlons de la stigmatisation de la femme, la stigmatisation de la femme, c'est surtout un problème culturel. La plupart du temps, quand on voit comme c'est la femme qui porte la grossesse, elle est pointée directement que c'est elle qui est la responsable de la grossesse. Et on a vu, certaines ont subi même des mutilations pour un problème d'infertilité. Et autre chose aussi, le manque de connaissances. Maintenant là, avec la recherche qui se fait, et comme je venais de le dire, on a bien établi que les personnes qui sont responsables de l'infertilité sont la femme et l'homme, et ce n'est pas seulement la femme. Quand nous disons la prise en charge dans nos milieux, il y a la prise en charge qui est du niveau 1. Les gens sont tellement dans la religion, les gens sont tellement dans la coutume, et que de prime abord, quand il y a un problème de fertilité, on pense que c'est soit un mauvais sort qui vient de l'oncle, on pense que c'était un problème ou bien une faute qui a été commise par la femme qui est responsable, ce qui fait que dans la prise en charge, souvent ils recourent non pas aux tradipraticiens, ils recourent parfois aux prêtres, aux pasteurs, avant de se confier à des médecins qui exercent la médecine moderne. Il y a des consultations chez des paramédicaux. Ils n'ont pas l'argent pour aller dans les hôpitaux. Ils commencent chez les infirmiers. Et tous ces traitements-là qui se font à ce niveau-là, parfois aggravent plutôt la situation. Il y a des personnes qui se sont données aux tradipraticiens, qui ont utilisé des produits, qui ont créé des synéchies chez ces femmes-là, donc qui ont aggravé le problème, et ils ont eu même parfois des trompes bouchées. Alors, dès que ce niveau-là est dépassé, on commence au niveau D, où on voit des assistants, et surtout des médecins généralistes. Et si ça ne va pas, on monte chez les spécialistes. C'est un chemin qui est très long et où la femme perd beaucoup du temps. Comme l'a dit mon prédécesseur, la femme naît avec un stock non renouvelable de plus ou moins 1 million de follicules. Et pendant sa vie, il y a une diminution du nombre de ces follicules, à telle enseigne que quand elle atteint 35 ans, elle a une déplétion très rapide du nombre de follicules qu'elle a, ce qui fait qu'à la ménopause, elle a au moins 1000. Pendant tout ce temps-là, la fertilité baisse, ce qui fait que le temps qu'elle perd au niveau 1, au niveau 2, elle arrive souvent au niveau 3 avec des ovaires qui ont vieilli et qui répondent difficilement au traitement, et les traitements deviennent de moins en moins efficaces. Là, c'est l'exemple du milieu camerounais, où on donne un peu les femmes, comment on les prend en charge. Vous voyez qu'à 20 ans, il est au niveau des tradipraticiens, avec des traitements qui sont efficaces si on atteint bien la cause de l'infection et autres, parce qu'il y a des antibiotiques. Il passe au niveau 2 et généralement, vers la 33e année, il est entre les mains des spécialistes. Mais notez que déjà vers ces années-là, au niveau de la quarantaine, c'est là où surviennent aussi des maladies qui impactent la fertilité, notamment les myomes. Et puis quand on parle des myomes dans nos milieux, ce sont des gros myomes, et puis des myomes très nombreux et qui gênent la conception. Et pendant cette se font sentir surtout des problèmes d'endométriose ou d'adénomiose, qui sont de situations quand elle approche la préménopause et la ménopause, dans ce moment-là qui arrive, entre les mains des spécialistes. Les traitements deviennent difficiles à porter, mais à cet âge-là, souvent, ce que nous constatons dans nos pays, ce sont des femmes qui, après avoir vécu pendant très longtemps, ont un peu plus de moyens en termes d'argent, mais les ovocytes ne sont plus là et on est obligé de passer à des dons d'ovocytes. Ce qui fait que dans certains centres, on a appris la politique. Comme ce sont des femmes qui sont d'un certain âge, ils n'ont pas trop d'ovocytes. On essaie maintenant de trouver des donneuses parmi les jeunes. Et ces jeunes, s'ils ont aussi des problèmes de fertilité, les soins sont pris en charge par les femmes beaucoup plus âgées. Ce sont des techniques que nous utilisons un peu pour pouvoir parer à ces problèmes de, comment dirais-je, de prise en charge. Voilà un peu ce que j'avais à ajouter à ce qu'a dit mon prédécesseur. J'ai dit et je vous remercie.
Thank you, Professor Justin. We would like to invite our third speaker, Dr. Francisca Bavalia, consultant psychiatrist and head of clinical care at Chainama Hills Hospital, National Mental Health Coordinator, Merck Foundation alumni from Zambia. Dr. Francisca is covering today a topic that is influence of infertility stigma, etc., on women and couples, social and psychological impact. She will also speak on how media can help create a sense of community sympathy and how to write inspiring stories. Can we please have Dr. Francisca?
Thank you. Good afternoon, everyone. Apologies for the delay. Privileged to be here this afternoon to speak around a sensitive topic and just to see how I can give some insight and hopefully create some empathy amongst the media team as we discuss this very sensitive topic. So I know Dr. Justin and Dr. Adam already did a good job with talking about the different biology around infertility. So I'll not bore you with that part. So I'll just fast forward the first part of the presentation. I'll not bore you with this part because I know they've done a great job describing that part. Though maybe just something to emphasize is that infertility is amongst us, and we want to just see how can we help our people prevent infertility, how can we help with them getting management and the treatment that they need for this diagnosis. And for you as media, you play a very key role in that. And I think that was the essence of Professor Justin and Professor Adams taking you through that aspect of how does infertility come about, how does it affect people, different families, highlighting the aspect that it affects both genders, so that even as we communicate that to the public, that information actually comes out. And also just maybe to highlight some figures around this. Other than infertility, I'll also be speaking around other aspects like gender-based violence and genital female mutilation, child marriages, which are all factors, various social factors that contribute to this aspect as well. So it is estimated to affect about 106 million people worldwide. And other than that as well, that is like 48.5 million couples. That's a very, very significant number. And there's a high prevalence in Africa as well as in Asia. This is a global situation, and it's something that needs to get our attention. And it's quite a challenge accessing these services in our regions. And not only is it a challenge to access them, they're also quite costly. So we'll also speak a bit more into that as media. How can you come in to create solutions around this? So this was just a figure just trying to highlight the global picture and just to mention that this is actually affecting a good part of the globe, the whole globe. But if we look at Africa and Asia, we can see even just by the deepened color that they were greatly affected. So I know they did a good job. I will not even bother to get into that science. So why is infertility important? It's important because it's encompassed into a good health and the right of every human being. It should be an issue of a choice, right? Everyone, if they want to reproduce, it's a natural desire for us as human beings and any creation. So it's actually a right for every individual to have that option. It's okay if one chooses not to, but it should be a choice. Then again, we want to mitigate gender inequality, especially amongst the women. For a long time, the understanding has been that when infertility is present, it's associated to the woman. But we're now understanding that no, that's not a fact. Infertility can come from any gender, both male and female. Sometimes even both parties could be contributing to the infertility, or it could even be the male gender. Then there's also a huge negative social impact. Unfortunately, a lot of us come from societies where one's reproduction is associated with their identity. So, and we've all seen the Merck Foundation video that highlights the extreme gender-based violence that can actually be an outcome of such presentations like infertility. So it causes so much, a lot of stigma, divorce, even clinical mood disorders, depression, anxiety, very common presentations amongst individuals who are facing or who are presenting with infertility. So just to highlight a few aspects as well on gender-based violence. So it is reported that 1 in 3 women is actually experiencing some form of gender violence. So that's again a significant number. So who are these women? So statistically, if we look right now in the room, if I look at my fellow women, if I count 1, 2, 3, meaning one of us somehow statistically should be experiencing some form of gender-based violence. So meaning it's very rampant, it's very common. Are we able to identify it? And I think there's been a great misconception. A lot of times when people think of gender-based violence, a lot of it is focused on physical violence. That's when a lot of times people give it attention. But when we're talking about gender-based violence, it actually presents itself in various forms. One of those forms is sexual harm, rape, sexual violence, child marriages, quite common. Are people still open to reporting? A lot of them are coverted. A lot of them are ignored for various reasons. Though when research is done, it is found that it's actually very, very, very common amongst us, though underreported. And of course, there's the physical harm. And the physical harm comes in various ways. I think at least a lot of attention has been given to domestic violence recently, which is good, but it's more than that as well. There's also genital mutilation, various traditions happening in various forms. Are we talking about that as well? And there's also physical punishment, especially in children and the young. A lot of that as well going underreported. Mental harm, emotional abuse, verbal abuse, that unfortunately people are even thinking these are norms and it's okay. Just because it's not physical, just because you can't see it, doesn't mean it's not causing harm. And it causes significant harm, which will then lead to physical harm. And these are also certain traumas that actually passed on from one generation to another, if not managed well or observed. So that's also another area that we really need to look into, as well as economic harm, manipulation around finances. If you don't do this, I won't give you money, I won't give you allowance, someone doesn't provide money for the food in the house, all those aspects. I see a man nodding his head strongly. Yes, all those are some form of abuse that a lot of times people don't pay attention to. And in our society, sometimes some of these things have been considered as norms, but are they? No, they're not supposed to be norms. Again, come into the picture. So it's important that we speak against some of these practices. Female genital mutilation. For a long time, I actually didn't have a very good understanding of this practice, and I actually thought it wasn't common. Until I think about 2 or 3 years ago, I was given a task to do such a presentation. So it forced me to take time to read on it. I think it was once I'd followed a documentary, but I didn't think much of it because it was a documentary in the eastern part of Africa, and I'm from the southern part of Africa, and I'm like, no, maybe it's just that community, that society. But after taking time to really read around it, I realized that it's actually quite a common practice. Very traumatic, very sad. And This is where female genital organs are injured. And these are not for any medical reason. And I think a lot of the myths and beliefs around them are very far from the truth. Very, very far from the truth. And I think in various communities, they have various understandings of that. But I think one common theme that I got from my research was the idea was for a woman not to enjoy or in the act, so that she focuses on pleasuring her male partner. But is that the way it's supposed to be? Is it supposed to be a chore? Is it supposed to be some punishment? And a lot of times the setups in which these exercises are carried are not safe because it's not a medical setup. So again, they're prone to other infections and it just complicates the whole process. So again, another thing that we need to talk about. A lot of women are suffering in silence and not talking about some of these things. And hence, again, the burden is thrown to you, the media team, to highlight some of these issues. It's estimated that about 200 million women alive have experienced that. And for me, what scared me was the estimation that was made for 2030, that an estimated 68 million girls will experience FGM between 2015 and 2030 from an analysis that was done. And for me, that was scary. And you're wondering, where is it happening? But it is happening. So how do we prevent such numbers? So again, here, I think I just wanted to highlight figures and percentages, just to show that these are not just statistics, which I don't know are just in the air, or where is she getting this from? But these are things that are being studied, they're being researched, and they're actually happening on the ground. And hence we need to give it attention. So it causes a lot of stress in many individuals' lives. And for a long time, a lot of times people would think it's just the women. And because traditionally or historically, a lot of times it's been associated to women. But in interacting with various couples, something that has come out is that actually also significantly affects the men. Because usually it's families, it's friends, everyone is asking. If people got married 1 month, 2 months, 6 months, that questions, hey, what's going on? What's happening? It's like, it's just this consistent pressure or expectation to deliver. So even the males are actually affected by it. And that's why we see even homes breaking up, because now they want to prove themselves. They go outside their home, outside their partner to prove. And that again causes more chaos, and it's just ongoing chaos, one thing after another. So there's like a lot of compounding stress. And through that, we notice like there's a lot of interference in marriages, in homes, regrets, and also the way society tends to respond to these individuals. Instead of just treating them normally, you see either people become oversensitive around them, others start hiding their pregnancies, or they don't want to tell them that they're pregnant and they think they're helping. But it just makes these people feel more isolated, right? Then of course, in other circles, people they'll boast about their fertility, the number of children. And sometimes these are things that we don't expect from people, but strangely, these are things that happen in our communities. Families insulting, removing people from homes, or bringing in other people to come and reproduce in their homes. So there's a lot of chaos that goes on. And hence there's need for us to normalize talk around it. And also and when we mean talking around this issue or this topic, it's not just for the individuals who are experiencing it. We're targeting various audiences. So even when we're framing our messages, our discussions, we need to know who our target audience is. Sometimes, yes, our target will be the individuals who are experiencing this infertility issue. But sometimes it's also the community around them, the family around them. How do they react to these individuals? How do they respond? How do they support? How do they interact with these individuals who are going through that journey? So they can be sensitive, they can empathize, with what they're experiencing. Because there definitely isn't a lot of sensitivity and empathy in our community towards these individuals. I'll give an example. People know that a couple got married, say maybe 3, 4, 5 years ago, and maybe they don't have a child. Then you see they're asking them that. Don't you think they already have enough pressure, first at an individual level, as a couple, then again, they get external stress from that. Though again, also important, what we'll be talking about is about solutions, right? I think there's already been some talk that there's help out there. Then when it comes to the child marriages, the psychological impact, how they're immature and they have to take up great roles, being mothers, being a wife, when they haven't reached that level of maturity to actually take up that responsibility, when they should be playing outside with their age mates, building castles, hunting, they're there trying to be, someone is still trying to understand themselves, identify with themselves, who they are, their position in life, and they have to start raising another human being. Is that fair? Have we allowed this individual, this child, to have a full experience of their adolescence? So these are some of the things that we could bring out. Okay, so yes, so it comes now to the role of media. For me, if I ended this presentation at this point, having created some empathy in you concerning these various situations, I think I would have done my job. For me, my aim today is just to get you to a place to have empathy towards these individuals who are experiencing these various things. And hopefully through having empathy for the positions that they are in, that can stimulate you, motivate you to be deliberate to speak around these topics, to highlight these issues in various setups. You play a major role. We are currently living in a world where everything is literally about media and social media. Whether it's a fact, it's not a fact, media runs the show. So that's the privilege that you have. So can you use this platform, this opportunity that you have, to make a change, a positive difference, especially in such areas that are not popular, areas that people are reluctant to talk about, areas that are taboo in a lot of our communities and societies. Though someone needs to do this job, someone needs to talk about these things, and you are privileged to do that. So, and this can be highlighted in various ways. Awareness, education, right? Just make people aware that these things are real. And just to open up the community to actually talking and opening up about these issues. Guide on services available. Yes, the services currently may be limited, but they are there. Guide people that no, you shouldn't suffer in silence alone. There are opportunities to actually get help, right? I don't know if most of you were part of this morning's presentations, the various scientific presentations. There's so much technology, there's so much investment, research that's going on around infertility presentations. And I don't think a lot of people are exposed to that. So there's hope. So we can communicate that to the public. And advocacy, right? Media, we know when you want to advocate for something, you people are great. You know how to package your information to get that attention that you need. Image, what do you see? I just want you to think at a personal level how you feel about this image when you see it. Yes, the image is catchy. It gets your attention. And you see the topic is infertility, right? But what emotions does it invoke in you? Are they good emotions, hopeful? Or they're more dark, negative? And sometimes it's as simple as that. And that's why we're talking about being careful. There's a psychology to everything. That's why even with art, people will look at a certain art and they'll feel a certain way. It's deliberate, and the artist knows what they want to communicate. Even when we speak, even from the way we ask questions and how we answer those questions, they're all communicating something to the public, directly, indirectly. So on such sensitive topics, it's important to be cautious of that. So this, if you ask me personally, when I look at it, it gets my attention. But I don't think it communicates something positive about infertility. It's more of negative, dark, and it's more likely to add more stigma towards infertility rather than positive attention. As much as you get people's positive attention, and it could add to the negative stigma around it, towards it being dark, bad, negative, not to be spoken about. So this is just an example I like to use when it comes to infertility. So communication should be very, very, very deliberate to highlight issues in a very creative way that gets people's attention. And if you can get lived experiences of influential people who can confidently communicate their experience or their good experiences about it, that would be great. I recently saw a meme about someone who posted that, why are people like this? They'll just come and post, thank you, Lord, for this new child. It's a miracle. But they don't tell everyone around them that they actually went through IVF for a long process to get there. And it's like they mislead others who are struggling, like, I've been trying just the natural way, it's not working. And they only tell you part of their story. What about sharing some lived experiences of individuals who've gone through the whole process? Share their truths of the experience, but the hope and the positive outcome of those. Those can be very helpful and liberating for a lot of people. So our aim is to see how we educate the community, increase awareness, we reduce the stigma around it, we help the health-seeking tendencies for the people around. So just to close, I would just like to encourage us, let's be solution-oriented as media. We have a great opportunity to guide people. Let's be solution-oriented. Let's create, through our media platforms, possibilities of where people can go, open up, talk about their issues, meet even with other people who are experiencing the same, link them to such places or services of support, right? Let's be the people who advocate, who lobby for some of these needs. Yeah, I think that will be it for me this afternoon. Thank you.
Thank you, Dr. Francisca, for the presentation. Mark's Pressure is a movie that has been made from a storybook, Mark's Pressure, which really highlights the most predominant factor about diabetes and hypertension. And I really hope that you all will enjoy this animation movie.
Mark is a 35-year-old hard-working young man. This has earned him several Best Work awards in his office. On a normal day, his desk is usually loaded with documents. Mark, who is a data analyst, manages to attend to various documents on his desk before the end of his working day, even if this means sleeping less at night or skipping meals and break periods. But recently, a few hours at work, Mark began experiencing occasional bouts of headaches.
My head aches badly. I need to get some painkillers.
Mark, are you okay? What's wrong?
Grace, it's just a slight headache. I'll be fine.
Mark's condition keeps worsening as he kept on working without rest.
This headache is still lingering on after taking the painkillers. What at all could be the problem?
Hello, Mark. Hope you are well.
Yes, boss.
Congratulations, Mark. Management has decided to promote you as a reward for your hard work.
A promotion? Wow.
You have been transferred to our headquarters with a salary increase. Congratulations.
Thank you very much. That's awesome. I'm so excited about this.
A few months later, Mark started working at his new office.
Unbelievable. I'm so proud of myself. A new office, a new beginning. Oh no, not again. This bout of headaches again.
The transfer came with more responsibilities. Soon, Mark's desk was swarmed with loads of documents. The pressure had doubled this time.
Oh dear. I'm tired, but I need to get this work done.
Hey Mark, what's up? You don't look too good.
Oh, nothing much. Just some bouts of headaches and back pains. I do have occasional blurry vision and neck pain.
Neck pain? Mark, you need to get a medical checkup. This could be signs of some sort of illness.
No, I don't need to see a doctor. I think I'm just stressed out.
I still suggest you see a doctor.
Unfortunately, taking migraine medication didn't work.
Whoosh! The headache keeps getting worse by the day. What can I do? Hello, Frank.
How are you doing today, Mark?
I'm still in bed. I may be late for work today.
Have you gone to the hospital already?
I will do so before coming to work. Thanks. Oh my God, I'm losing my hair. It must be all due to the daily stress. I definitely need to go to the hospital.
Mark heeds the advice from his colleagues and decides to visit the hospital to check his blood pressure. To his surprise, he had high blood pressure, 170/100.
Your BP results show you are hypertensive.
Hypertensive? What is it?
A normal blood pressure reading of 120/80 is considered normal. As it stands, you are hypertensive. Hypertension occurs when your blood pressure becomes too high. This means the force of the blood pushing against the artery walls is consistently too high. That means the heart has to work harder to pump blood through the body. Aside old age, other risk factors include obesity, stress, smoking, lack of exercise, high alcohol intake. Symptoms of hypertension include headaches, nose bleeding, shortness of breath. These are a few guidelines to know your hypertensive state. A normal blood pressure rates 120/80 or lower. Stage 1 hypertension rates between 130 to 139/80 to 89. Stage 2 hypertension rates 140 or higher/90 or higher.
Mark also learns from the doctor that his family history predisposes him to the condition. To stay healthy, Dr. Timothy advised Mark to avoid the following: alcohol, salt, sugar, smoking, and stress. He advises Mark to exercise regularly, eat healthy, reduce red meat and processed food, and include more vegetables and fruit in his diet. The recommendations was rest. Mark had to take time off his busy schedule to rest and refresh his body. Difficult as it was, Mark stuck to taking his medication religiously.
My biggest challenge is the medications. I can't believe I have to take these BP drugs on a daily basis. Doctor says I was lucky. Early detection of BP saved me from possible worse effects like organ damage. Make sure my life is not threatened like this again.
He also got himself a BP monitor to regularly check his status. This way, he knows what to do when indications are not good.
147/80, that's better than yesterday.
Soon, Mark's commitment to regular exercise, reduction in salt intake, reducing stress from work, regular blood pressure monitoring, and sticking to medication began to pay off. Mark's efforts helped him control his blood pressure within normal limits and eliminated all his symptoms.
This is amazing. No more hypertension.
This success compelled him to write and publish a book to encourage others not to see high blood pressure as a death sentence. With the right attitude, stress management, a good balance between work and rest, timely medication and healthy lifestyle, hypertension can be avoided and or managed well.
I'm glad that all of you all finally had your eyes hooked on the screen, which probably shows that this is something we all really relate to. And especially, I think in today's world, unhealthy lifestyle has become a part of our daily routine, probably. And stress is something that we all deal with, be it personal or professional stress. And I'm sure that when you all are going to go back looking at this movie, you will for sure go and get your stress BP checked. And I'm sure you're going to go and probably apply a few stress management techniques. Yes? I hope you all are not. Yes? Yes, that's like a good crowd. Let's have the next speaker for the day. We would now like to welcome the fourth speaker for the day, Professor Mohsin Siddharth, Community Health Department, Faculty of Medicine, UEM, member of Board of Trustees of Merck Foundation from Mozambique. Professor Mohsin Siddharth will be talking about promoting a healthy lifestyle and raising awareness about prevention and early detection of diabetes and hypertension. He will also highlight on how to report it to the community. Over to you, Professor Mohsin.
Thank you very much. So good afternoon to everyone. It's my great pleasure to be here and to share some of my reflections around hypertension and diabetes. As my colleague said, media is a powerful tool to change many things, politics, etc. But it's a very powerful tool also to promote healthy lifestyle, self-care, and as our colleague said, sometimes the workload we have, the social and other obligations do not allow us to have a stress-free lifestyle. Sometimes is not a choice, but it's the context. So we have to try to take care of ourselves, but also, sometimes it's not a choice, but we need to do our best to take care of ourselves, but also our community. So I'll share with you some of the things. The video was very interesting. And you can see that sometimes some of these diseases like diabetes and hypertension can start giving you some signs. Something is not good, something is wrong. And we need to know what are these signs so we can screen ourselves and then look after it. So broadly, non-communicable diseases are diseases that are not related to infectious agents like microbes, parasites, virus, bacteria. These are diseases that are multifactorial. There are other causes. It is a group of diseases that are included here. We mainly talk usually about cardiovascular disease, diabetes, cancer, and chronic respiratory disease. But there are many other diseases that are, can be included within this terminology. Why we develop non-communicable diseases, the reasons are many. There are factors related to our genetics, our physiology, means the way our body works, the environment, the context we live. This includes work environment and social environment and other stresses that we have within our, and also some of our habits, our behaviors. If you see statistics, I did not bring here, I have a slide on brief statistics, but if you see statistics, you will see that non-communicable diseases is becoming a leading factor of mortality, of deaths in low middle income countries. It is replacing infectious diseases which were the main cause of that. If you see some statistics, and for each country, actually, you can see that, you will see the change that is happening in our countries. Unfortunately, our countries, we still face burden of infectious disease. They are still there, but the burden on non-infectious disease, like chronic diseases, are increasing every day. So there are many, you can see. We'll focus more mainly in high blood pressure and diabetes. Some people consider diabetes and high blood pressure as condition, not necessarily as a disease, because we can do something about it and we can improve our condition. So diabetes, I will explain to you, is a result of hyperglycemia, which means high value of glucose in our blood, glycemia, okay? And high blood pressure, have you seen in the video, is because of the blood pressure that in arteries is increased because of different factors. Okay, so you can see here some data, okay? Females and males. This is global burden. I did not bring for a continent, etc. Oh, this is, no, I brought actually. This is Sub-Saharan Africa. The slide is not very well focused. Can you see properly? Yeah, so it's my problem. But anyway, just to show you that some of the chronic non-transmissible diseases, they are becoming very globally very important, okay? But also in Africa, Sub-Saharan Africa. See, the burden of 4 main non-communicable diseases is responsible for about 80% of deaths worldwide, okay? And you have a distribution here of different causes. The risk factors for this, most probably you have heard many times. A part of those that I mentioned in previous slides, like genetics and behavior, etc. You have unhealthy diet, smoking, inactivity or physical inactivity, and excess use of alcohol. So within diet, you also have to think about not just diet rich in fats, but also diet rich in salt is responsible for non-communicable disease. These causes, these risk factors, they can cause different kind of non-communicable disease. They are responsible for cardiovascular disease, diabetes, cancer, and others. Okay, so we usually tend to classify the risk factors in those that we cannot modify and those that we can modify. Those that we cannot modify is age. Every day we age, we cannot do anything about it. We cannot stop aging, okay? Our sex, our genetics, our genetic makeup, we inherit from our ancestors. And also, you know, exposure that we have or the babies have during fetal, during pregnancy. Okay, that's why pregnant women need to, women need to take care with their pregnancies, because some of the factors that will impact on the baby then will have consequences later in life. Okay, so within fetal organs, there are also those that we cannot control, but there are some that we can control. Things that we can control is we can control our smoking habits, use of alcohol, our diets, our physical activity, etc. And other factors is like air pollution, which is becoming, because of the climate change and pollution due to different factors, it's all becoming very important factor in non-communicable diseases. Even cardiovascular disease, for example, was due to smoke exposure, air pollution, etc. Okay, so what these risk factors will do, it will affect the functioning of our body, which will be responsible to us getting obese, or our lipid profile, our fat profile changing, our blood pressure also changing, and other aspects in our body changing. So this will impact in development of these diseases. Okay, so as the previous video showed, diabetes, high blood pressure, other chronic non-transmissible diseases, these are very kind of silent diseases. If you don't screen, if you don't check up for them, you won't detect them. And by the time you detect, maybe it's a bit late. For example, recently we are having increase in cerebrovascular accidents, like stroke, commonly said. In Mozambique, young people enter maybe in average 3 to 5 people in different hospitals in the country, enter per week with stroke. And most of these cases of stroke, they are related with high blood pressure. So we don't want to get to that point where, because we are humans, sometimes we have headache, we just neglect. It will pass, take aspirin or paracetamol, it will pass, and we keep going, we keep pushing ourselves. We are not sensitive to ourselves as well. And then by the time something like this happens, recently I also saw about 34, 35 years old, strong young man who had a heart attack. Unfortunately, it was far from the city. By the time he came to the hospital, he died. See? So these things are happening now earlier and earlier in our lives. Our lifestyle, the risk factors I mentioned, our diet, so we need to, so this talk is to, together with you, try to sensibilize, try to raise awareness for people to check, and they can check for blood pressure, for blood sugar, for other risk factors. It is not necessary to have something very prescriptive. You can check randomly. If you don't feel anything, doesn't matter. Let me check. And one of the things we do, for example, in Mozambique, to promote this checkup, we call it Feira de Saúde, means that health fair. We organize health fair. We have health professionals checking blood pressure, checking sugar. And of course, they talk with people. Have you ever checked your blood pressure? Have you ever checked your sugar, please? Do you want to check? Do you want to know your level of sugar? And people come and approach, and suddenly you see he's hypertensive. Suddenly you see she's diabetic. And sometimes early detection is always good because you can avoid complications. And in one of the sessions for Portuguese-speaking countries, someone asked why chronic diseases are very expensive. They become expensive when you allow it to develop, when the complications are already established. But if you do early, if you are aware, if you screen, if you start taking medication, your blood pressure gets back to under control, your sugar gets back under control. You don't have consequences, complications. And the complications for high blood pressure, complications for diabetes, we'll see next slide. They are in what we call terminal organs, like kidney failure. Imagine, kidney failure, then you need dialysis. Dialysis is expensive. Even for public sector, it's expensive, So if you don't control, you have problems with your vision. It's expensive. And it's also what we say in English, it reduces your quality of life. It impacts in your quality of life. Imagine impaired vision, which can get worse. It can lead you to blindness. You know, imagine neuropathy. For example, a diabetic patient that doesn't know and enters in the hospital in coma, it's a big problem. He can die. The first episode that enables the health professionals to see that person is diabetic can be fatal, you see? So it's important. And in public health, we speak about prevention. And prevention happens along the continuum. Prevention happens before onset of disease. Prevention can happen also after onset of the disease, okay? So when we do everything like education, raising awareness, changing behaviors, etc., we are talking about primary prevention before onset of the disease. But when the disease is detected early, we are talking about secondary prevention. We don't want the disease to progress. This detection can happen with routine checkup, but can happen opportunistically. So for example, if you go to a health facility for any reason, or you accompany your kid or something, you know, you have opportunity to check your blood, your blood pressure. It's very quick, you know. You can ask the health professional, can you check my blood pressure, please? And very quick. Okay, blood sugar, you need to take some blood. Maybe you have to be fasting, but blood pressure is very easy. Secondary prevention is not only early detection, but it's also taking medication to control. This is very important because there is the concept of chronic disease is a concept a bit complex in our context because people were used to infectious disease. When you have a disease, it's acute, you take medication, you are cured. Here, in chronic disease, it's not a cure that we are looking. What we are looking is control. What we want to do is bring our blood pressure, bring our sugar, blood sugar, other parameters under control. And we can do it with treatment, but not only. We can also include some life changes, but treatment is very important. So it's kind of a lifetime treatment, okay? So if we take treatment appropriately, we can avoid complications. We can prevent progressions, okay? And even if it's in advanced stage, because, for any reason someone was not detected early, it's never late. If detected, we need to prevent, because there are many, many other complications that can happen along the path of development of diabetes or hypertension. So we can do always something. So this delay is taking time. Okay, so there are some signs I will try to run that we usually say 3 Ps, It's like, when should I suspect of diabetes? When I feel, for any reason, because we have our routine. Imagine if I walked long distance, I will feel thirsty. But for no specific reason, I feel that now I'm feeling more thirsty than usual. I'm feeling more hungry than usual, and I am going to urinate more often than usual. Then we need to suspect something is wrong. This is not my usual pattern, and this is, oh, sorry. So the 3 Ps is our guide to seek, to triage, to screen for diabetes. So it's not going back up. Anyway, there are other symptoms there, doesn't matter. But the 3 Ps are very good, they're very sensitive. In public health, we say, we use a test. If it is sensitive, of course, if we have these 3 Ps, we go to check, we might find our blood sugar normal. Doesn't matter. It's important because we discarded diabetes, isn't it? Huh? Do you agree? because you checked your blood pressure, you suspected, you checked, everything is normal. But if you don't check and something is not normal, then is a problem. Then the complications. And some of the complications are here, you see? Vision, heart, kidneys, etc. So what we want to do is to control our high blood pressure and to control our sugar, to avoid complications. Prevention we can do, by controlling our weight, being physically active, our diet, avoid the use of tobacco, etc. High blood pressure, you saw the video, is called silent killer. I will pass quickly these parts. It's not important to know the values because the doctor will tell you. The health professional will say, oh, your blood pressure is in borderline within the limits that you need to be careful, or it's normal, or it's high. A person with high blood pressure usually are asymptomatic. Sometimes you can have headache, but you might not have headache also. It doesn't cost much to test now and then, okay? Particularly if you have risk factors, like myself. I have some risk factors. I'm also work alcoholic, like Mark was there. But the context obliges us sometimes, You have to work hard, this and that. But it's important to control blood pressure, because the only way I can say I have high blood pressure is by controlling. And you need to control in different times, because high blood pressure is not regular along the 24 hours. And if you really suspect that sometimes your blood pressure is high, there are methods. The clinicians know how to measure your 24-hour blood pressure, etc., and to detect when your blood pressure usually, and that's also good for medication, actually, when to medicate, because blood pressure varies along the day, okay? But the message here is that you need to check it. We saw some of other symptoms and signs, headaches, nosebleed, change of rhythm of the heart, vision, buzzing of ears, all these things can happen. Complications, they are very similar like diabetes. Usually they are in terminal organs, you see, like brain. It can happen also with diabetes, like heart, kidneys, okay? So we need to take care to avoid the complications, okay? What we can do to prevent? Some of the recommendations here from the WHO: reduce salt. Okay, I know many of my friends, when we go together to eat, before even they taste food, they will put salt. And I ask them, "Wait, you didn't even taste, man. Why you are putting more salt?" And salt is a big responsible for high blood pressure. Then you have other factors, alcohol, great use of alcohol, inactivity. Activity, you don't need to actually go to gym to be physically active. According to WHO, if you have minimum 3,000 steps, and 3,000 steps is not, a step is not 1 meter. So it's not 3 kilometers, okay? It's about normal 3,000 steps. If you can, even during working context, you can walk 3,000 steps. Minimum, if you walk 3,000 steps, ideally, if you can walk 5,000 steps, you are physically enough to keep your body function, okay? This is a WHO recommendation. I'm not making it up. Avoid tobacco, avoid fatty foods. In our context, particularly if we are far away from home, we tend to eat, ready-made food, sometimes very rich in salt, very rich in fat, so we need to avoid. What we can do to control it, we need to follow medical advice, take medications when we have high blood pressure, have a regular checkup, and reduce and manage stress. Yesterday we had a session, I don't know if some of you participated in yoga session to relax. There are many techniques, you know, I mean, YouTube is full of some of the techniques we need to learn. Some people can relax by reading, some can by walking, some yoga, anything you can use to relax, but it's important to relax. Otherwise, you will explode. Intensity of work, back home, intensity of other things can go wrong. So your role, my colleague Francisca emphasized, you have a very important role. And the role is to promote awareness. Check your blood pressure. This is non-transmissible diseases, chronic non-transmissible diseases, NCDs. They are reality now in our countries. We need to be aware of them. And diabetes, hypertension, they are one of the main conditions that we find among ourselves now. We need to be aware of it. Our community needs to be aware of it and not wait until we don't have to think that I'm not old enough to have these conditions. As I told you, we start having patients younger and younger with these problems. So we need to be careful. Okay? And sometimes they might not they might not be obese, but they have high blood pressure. See, so check it. So we need, as media people, we need to raise awareness to do that. We need to help health workers to expand, because your reach is greater. You can reach many people through different platforms that you are experts on using. We are not very good communicators as health professionals, you know, and you can see posters and videos when it's made by medical professionals. They are not that good as they are when they are made by communication professionals, because they have expertise in communication. So I will not take more time. The idea was to share with you the importance of these two conditions, hypertension and hyperglycemia or diabetes. And so we can make, if we raise awareness and if people control themselves, so we can make real difference in our communities, in ourselves. Thank you very much for your attention.
Thank you, Professor Siddharth, for a lovely presentation. We would like to invite our fifth speaker for the day, Ms. Christine Goku, Director and in charge of Training and Curriculum Development, Media Council of Kenya. She will be talking to us about the role of media in reaching out to communities at grassroots levels and raising awareness on health and social issues like infertility stigma, girls' education, child marriage, GBV, and FGM.
Thank you very much. I want to just say sincere apologies because I'm not at my best. Okay. I just want to apologize for having this look. But it comes with the task of being who I am. I'm an active person, and so it's the reason why this has happened. You've already read who that is. I think I'm happier to be standing on this side, then it's easier for me. I want to talk to us about the role of media in raising awareness about these issues. These issues are everyday issues. They are issues that people are dealing with in our own families. They are issues that we ourselves are dealing with. You know, I was beginning to shake a little bit when Dr. Francisca was talking, and she was saying, if she counts 1, 2, 3, 1, 2, 3, one of us women have faced gender-based violence. And I said to myself, that is so serious. We need to take care of it. We need to also start talking about it. So in my presentation today, I'm going to basically look at these 3 factors. And this is the part where the teacher in me comes in, because you can see at the end, I'm going to give you some media tactics. That means you will need your notebook. You will need to write some notes. Oh, just to be careful, I might just throw in there a quick assessment test. It's called a cat. You know, a cat, you don't feel it when it's coming. It just crawls on you and gets to you. So let's start talking about how the media fits into these social issues that we talk about. So why does it matter for us to talk about these social issues? Why is it really important? It's important because we reflect our societies. We reflect the society's values. We reflect the society's way of life, the culture of the society. We reflect what our life is about. And because of that, we should not even fear writing about it, because it's something that everybody knows about. Only thing is this, if we fail to do it, then some practices which may not be very good continue, like FGM, like infertility being kept a secret. It is something that people don't talk about. But infertility is everyday experience for different people. Therefore, we need to remove that secrecy about it. For us in the media, we amplify the voices of society on social issues. What is society saying about high blood pressure? What is society saying about child marriages? Is society saying it's a good practice, we must continue with it? What do we want to say? Therefore, we need to begin to amplify the voices of those people that talk about some of these social issues as bad practices that we need to abandon, we need to change. The media itself points out areas of concern, these practices in our own houses, and then we can write about it. Then we miss out on the concern bit. We cannot be behaving like we are outside the community. We are part of the community. And so when we write about these issues that have to do with society, our practices, we are writing about ourselves. And if we are conscious and we are concerned, then we will keep on writing about it. You know, I've already, as the doctors were speaking, I already found like many headlines that I could actually put on a newspaper, or even just a tip that I could put, you know, just before the news comes on broadcast, just before that clock comes to the top of the hour. I know many media houses do that. You can just put a salt shaker and put a cross on it and say, reduce on the salt for just 15 seconds. And then the clock comes. Everybody sits there to watch the news. Therefore, they will get that message up about, you know, reducing on the salt. If you think about it, there are many creative ways that we can communicate on this. Again, we need to also create that platform where people can discuss it. We need to demystify the myths and misconceptions. I think today and yesterday we've been told, and it's been repeated, that infertility is not about women only. It's about men and women. And therefore, we need to start talking to our young generation, growing generation, those who are not unmarried, those who are 10 years old, those who are just getting into puberty, the 13-year-olds, the 15-year-olds. They need to know that if infertility shows up, it's not their fault. It is because of many other issues, and that it is not just the girl or the woman. It is both the girl and the boy. So we need to remove that myth that infertility is about women. We also need to think about the media as being the neutral frame. This is where anybody can come and talk about any of the social issues, controversial, non-controversial, in a free space. It is the social space where we can discuss. We can talk about things, agree and disagree, but at least we have a place where we can express ourselves. So for us in the media, we have a lot of work to do. How do we establish the information gaps? I think between yesterday and today, we've been told where the gaps are, where the misconceptions are, and the issues that need to be addressed and how they can be addressed. So I am saying that we need to establish the context. Who is talking about it and in which context are they talking about it? Read widely about the subject. Talk to community groups and representatives of those community groups so that they understand some of these issues. Many times, people feel free to talk to journalists as opposed to talking to a politician or some other person, because they trust the journalist. They know the journalist is going to amplify their voice, to amplify their opinion. You see, the minute we are able to identify a person who can talk about their issue freely and openly to us, then we can amplify it and make it not look like rocket science or something which is hush, hush, we're not talking about it. So we need to amplify that voice. We need to also identify who are the message carriers in our community. I'll give you a quick example. At some point, I worked with a development agency, and what we were doing was sending communication or information about breastfeeding. We wanted to increase breastfeeding in a certain community in my country, Kenya. And so we went out and we went to the hospital clinics and we got the women and we talked to them about it and gave them flyers and even gave them t-shirts and other kind of things which carried the message. They went home. And because it had a monitoring and evaluation section to the project, we came back after about 6 months to come and check, have the numbers of women who are breastfeeding increased? At the hospital, are they seeing less and less problematic children because of not being breastfed? So we started off at the hospital. We would go to the hospital and we asked, oh, has there been a reduction? And they said, no, there's been no change. We talked to the women who had brought their children. We asked them, are you breastfeeding your child? They said, no, 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 we are not doing anything. You know, we are doing the same way we always did. And so we got confused and we said, what is the problem? And then one of the male doctors from the community came to us and said, you have a good message. It has gone to the women, but you're sending it with the wrong messenger. We said, well, how should we do this? They said, in this community, it is the men that carry the message. So we said, so what do you mean? They said, go and talk to the men about their children being breastfed. It's going to happen. It sounded very awkward, but we now had identified who is the correct messenger, who carries that message to the wives. Now, it's a very highly patriarchal society. So we looked for the places where the men gather and we told them the benefits of having a breastfed child and so on and so forth. Believe you me, we came back 6 months later and all the women were breastfeeding their children. Why? It was an order from above. That language sound familiar? Orders from above. The head of the family gave an order, you must breastfeed my child. So the women were breastfeeding their children. So do you see the importance of having the correct message carrier? So as the media where we are, we need to start thinking, who is going to carry the message? Where do we put this message? I'm even beginning to think we need to have a men's page in the newspaper so that we put in some of these health issues on the men's page. You know, when we put it in the women's page and in the women's pull-out magazine, the men don't read it, but the men need to read it. So maybe we need to introduce a men's page where they talk about going to the gym and talk about getting tested for pressure, maybe checking your levels of blood sugar. And I'm not saying don't put it in the women's page, but this is a new place where you can introduce such kind of a segment. Anyhow, how do you work on your story? Seek out the experts. In this conference, there have been very many experts. I am hoping and wishing that yesterday you got a contact, a WhatsApp number, or an email that you can email one of the experts in the different fields of people that we have in the conference. Because those are the people who will give you expert content. And you don't have to interview only doctors in your country or experts in your country. The variety is good because we want to hear what happens in another country of the same situation. So seek out the experts. Apart from seeking out the experts, capture the facts. That means because you have read a lot, you know what the facts are. Find the surprising data. I was very surprised by the first doctor who made the presentation when he said, the occurrence of infertility in men and women is 40% and 40%. And I said, hold on a minute. I've always thought for women it's 80% and men is 2%. That's me. Think about this. I am highly exposed. I read a lot, but that is a data that I didn't know. What if you went and put that data in your story to surprise everybody? They'll be curious to want to know, how is this? You know, you need to get that hook. We need to also have a clear takeaway for the audience. What are you telling the audience to do? The doctor who just spoke before me has said, when you're not sick, have your blood pressure tested. When you are not sick, you have nothing to complain about. Maybe you've gone to complain about your arm like me. Just tell the nurse, hey, can you check my blood pressure? It takes a few minutes. And you know, if we were to do, you know, such progressive things, such that there is this progressive information where we demystify blood pressure, we demystify diabetes, there's going to be more willingness for people to get tested, for people to check their blood sugar levels. So think about it. What is it that you want the audience to do? You also need to think about incorporating anecdotes, stories of people who have high blood pressure and have not died. They're still here. They're still useful in society. They're still able to perform their tasks as mothers, as fathers, as brothers, as CEOs, as doctors, and so on and so forth. You know, get the story. We write stories about people. All these social issues we are talking about are about people. They're not about trees. They're not about stones. They're about people. People have an experience in any of these social issues we are talking about. HIV, diabetes, child marriage, all of those, they are about people. So put a face to those social issues and then identify some champions, people who champion the cause of some of these social issues, people who champion for girls to be married at the right age, when they are already mature, not when they are children. When they are children, they have many problems. First, the psychological stress. They're thinking, here I am with this man. I'm supposed to cook for him. The child is stressed already. And then now you begin to add other issues to it. It stresses the child completely. So identify champions in your communities, highlight their cause in these social issues, and then use some visuals. You know, pictures are more interesting for a person who is consuming information to want to read more, to want to know more. Watch out for stereotypes. Some stereotypes are not obvious. Some stereotypes are not obvious. We may not think about them as a stereotype. We have this stereotype that big-bodied people, I don't want to say fat, but people who have big bodies are the ones who will have high blood pressure, they're the ones who will have diabetes. No, it's not an obvious stereotype, but it is. It's one of those things that, oh, you see somebody who's overweight and you think, oh, that one must be having high blood pressure. But believe you me, even a very lean-bodied person can have high blood pressure. So we need to see the stereotypes and demystify those stereotypes. We also need to look out for misinformation and inaccuracies, especially the inaccuracies. You know, we are given information by a person who is not necessarily an expert, and we think just because we assume they know, that must be correct. It may not be. So you need to think and look out for misinformation and inaccuracies. Again, I also want to say this. There's this question of fact checking. Whatever data you put in, please fact check it. It's easy to do that today. So look out for the facts. Think about detractors. Detractors, who are the detractors? They're the people who come and tell you, oh, actually, some of the detractors may actually be in your media house. They might tell you, oh, you're writing something about diabetes. Oh, it's not an important subject. It is very important. Oh, you're writing something about infertility. Did you put men there? Remove the men, just leave the women. That's a detractor. And you know, they do that because they have certain power. They do that because they have a platform. Don't allow them. Don't allow them. If you're writing about infertility and you have the picture of a man and an editor or someone else tells you, no, this is not the correct, or this is not the acceptable profile of infertility story, tell them, no, this is where the difference is. This is where you get that surprise. Remember the surprising detail? When you put an infertility and then you put the picture of a man, everybody thinks, hold on a minute. This man, he looks energetic, he looks healthy. Can he really be infertile? Those are the things that you want to look out for. You also need to look out for the myths. I don't want to belabor the point because I think you know what that means. How do we fit in the puzzle? We fit in the puzzle in this way. Audiences trust the media to give authentic information. Remember about the fact checking I was telling you about? This is how we fit in the puzzle. There's a lot of information around us about those social issues. Yesterday and today, there's so much information, but the audience trusts what the media will say. So pick out that information and put it on the media. Craft your story using imagery. Ask people to imagine, that the audience can identify with easily. Talk about a woman who sells tomatoes in the market. I can identify with that woman. I don't sell tomatoes, but I will buy tomatoes from her. Talk about a man who is a CEO, a man who is a director, a woman who is the chairman of this organization. Those are real individuals that people know. If you talk about them and how they relate to some of these social issues, then the audience will say, hold on a minute, that person can be me. That person I can identify. That person can be my sister. That person can be my elder brother. And so it's easier for them to now take in your story. Use the community channels of communication. I'll take you back to my anecdote about the community where we were telling men about breastfeeding of their babies. In that community, some of the things that we were using were banners like these. We were using t-shirts. We also had posters and so on and so forth, even a TV program. But the message was not going through because we made one big mistake that we didn't even think about. We used the color red. Just the color red. We use it in our communication. Anytime that community sees the color red, it means danger. It means stay away from that information. It means the person is an aggressor in that community. So they shut the messaging. We put everything everywhere. In the market, we put the posters. The next day we'll come and find them, tone them down. And we were not understanding what's going on until someone just pointed it out to us. You have this little color here. That color is repulsive to the community. Therefore, we went and redid, now with the correct colors. So I want, even for us as the media, we need to think about how the community communicates. If you're writing for the middle class who can read books, or they can actually follow on Facebook, or they can read content which is online, put the information there. When you're talking about the community, use the channels which they use as well. If it means for you to go to the community itself and actually ask someone to craft the message there on your behalf, please do. Because then the message will get through to the members of the community that we intend to target. If you just leave it out here in the urban areas, yet the communities don't know, it will remain in the urban areas. We want to be able to cut across. We want to be able to target the people who are employed, the people who have a lot of education, and we want to target also those who have little education. People who speak in a local language. In my country, we will call it a mother tongue. I don't know why it is a mother tongue. Is it not a father tongue as well? Do you speak a mother tongue or a father tongue? One of those. You speak both. Exactly, because what if I have a mother who speaks one language and a father who speaks a different language? Which one do I pick? No. They call it a mother tongue, yet they make my mother speak the language of her husband. which is my father tongue. It's my father's language. Anyway, so think about how our messaging needs to also go in all of those languages. A language which is easy for our audience to understand. A language that they can identify with. A language whose images means something to the community. So think about those communication channels and then deploy different approaches for your story. I have seen Merck Foundation have done excellent. I'll say Merck Foundation has done excellent. Why? They have targeted the young people. They have those storybooks. They have targeted us who want to just look at images. They have the videos. They have books. They have posters. They have, look, we need to borrow a big leaf from Merck Foundation. I think they've done a very good approach to their communication. So establish relationships with the audiences, the people we are targeting. Look for that opportunity to start a conversation with them. And you can start a conversation with them through a newspaper story. And they can start to give you feedback on a newspaper story or on a TV segment or even on your podcast. Capture them in the podcast. Let their voices be heard. Some of the media tactics. This is the point at which you take out your notebook and you start writing notes. Guys, class, we start writing now. So what do you need to look for? You need to look for the pre-existing perceptions. I wanted to put here the word misconceptions, and then I realized maybe not all of them are a misconception. So I just said, look for the pre-existing perceptions. What do people think about infertility? What do people think about diabetes? What do people think about female genital mutilation? Once you have established that, now look for a logical angle to your story. How do you approach that subject? You don't go fighting. Communicators don't fight. We don't go confronting. We go in a subtle way. We actually go and say, try to understand why they think that way about female genital mutilation. And then just throw in a spanner in the works where you ask them, what if we did things differently? Then they stop and they think, what if we did things differently? What would happen? Then that begins the conversation. Look for local news sources. Look for the person they know. Look for that doctor in their clinic. Look for the nurse who lives next door to them. Capture that in your stories. Capture that in your podcast. Capture that in your documentaries, in your videos. I like the animation that they have used because it's very neutral. It's not necessarily this or that community. But when now you go back home, think about how are you profiling these social issues. The nurse that they know, they see her every day. The nurse that they know, they see him every day as he buys oranges from them. And they'll think, hold on a minute, I read something that has been written about this person I'm selling oranges to. Then now they'll go back to the message. So you need to think of a creative way of packaging your news, using the local sources, local people who you can profile. And then think about the local communication channels. Think about what is it? Is it the radio that they use most? Is it the television? Do you have any images that are there that communicate the message? Is it the newspaper that they read every day? In some places in my country, they can read a newspaper even when it is 3 weeks old because it's still new to them. They haven't had that information. So it's okay. You can still put that information there. Creating the media content, mobilizing families and communities through locally produced media content and debate. In my country, we have a very high number of radio stations. And everybody wants to be heard on that station, on those stations. So there are these segments where people call and they give an opinion or they get an opinion or they say something to someone. Use it. Use it. Those radio programs where they have those phone-ins. Populate that particular content there. Let's talk about infertility in men. You know, I would want to actually have that as a segment on a radio program, especially the ones that come in the morning. You know, the breakfast shows Those breakfast shows have very controversial issues, and many of them have to do with social issues. Fertility among men is going to be a winner. Believe you me, they will say, no, tomorrow we must talk about it again. And the third day, why are there real men who are? They'll talk about it the whole day. Listen to that now. So, and then give the community voices a platform to be heard in the media. Sometimes we stay with the politicians, we stay with the leadership, we stay with and we forget members of the community. One day, tell the journalists in your media house or tell the journalists that you work with, take a recorder, go to the market, go to the street, record an opinion about a particular subject. These social issues we are talking about. In fact, one of the ones that I would have wanted to go and assign a reporter, if I had a media house that I was working in now, I would tell them, please pick up that and go to the streets and ask, have you tested for your pressure? Have you tested your pressure? And just hear that yes, no answer. And then you know what will happen? Before long, in 5 meters, there will be a crowd of people following because they want to know, should I go? Why should I go? And you see that opens discussion and debate. Put that on radio, you'll be surprised. There'll be many people calling to say, now, if I go and test and they, you know, there's always the fear before you do it. If I go and test and they say I have high blood pressure, what happens? Do I become a sickling? What happens? Will they tell me to stop working? Will they tell me what will I do? Will I afford the medication? All that discussion needs to be had, and the media space is that place. Again, some information, let me just go back 1 minute. Again, we need to use those lived experiences and the champions to destigmatize social issues, to destigmatize the social issues. We want to talk to those people who have gone through this experience and their life is normal. We want to go to those families that have had question of infertility and they have dealt with it. We also want to do, talk to mainstream the socially taboo subjects. Infertility is one of them. Female genital mutilation is one of them. We don't talk about it because it's considered almost like sacred culture. We need to talk about that. These are a few links that you can use to get some useful information. Information which is verified, not information where you're guessing, or information where you're thinking, can I trust this source and so on? These are just some of them. This is where I want you. I want you to be this guy who wears the happy socks. Everybody else is very formal, you know, towing the line. Oh, you want to talk about infertility? No. Our media house will not agree. You want to write about FGM? No. You look, be the guy who steps out in that socially uncomfortable space. Let's be the ones who stand out. I think he looks pretty cute there, you know. I mean, he's like, yeah. Look at also the posture of all the other legs. They're flat on their feet. This guy is in motion. Do you see that? When you stand out, you're in motion. When you stand out, you are in motion. So I need you to be this guy. I need you to be this guy. Oh, I wanted to tell you something about this link that I have put here. This link that I have put here is not for this picture. This link that I have put here, I had hoped that I would have the kind of screen where I could go to this link. This link has an image of one of our very popular, highly respected journalists. He hosts the level of CEOs in his talk show. The serious politicians, the presidents. You know, his name is Jeff Koinange. Jeff Koinange, 2 or 3 weeks ago, Gladys, can you remember? Glory, can you remember? 2, 3 weeks ago? About, let's just say 3 weeks ago, he was on a set and he talked about his struggle with infertility. My friend, everybody stood back and thought, hold on a minute. How in the world was this guy, high profile, very well respected journalist? He was struggling with infertility. And he talked about it. He can be quite a comedy. So he stood up and he said, he was talking about his life and other things. And then he said, and then there was this thing that was disturbing us. And in the family, I was not able to have children. So I don't know whether it's the machine that was not working. And everybody burst out laughing. But after that, the effect of that is that people started to think, it's not so bad. If Jeff Koinange could have struggled with infertility, hey, it's possible. And then he talked about how many times they did IVF. I think they did 6 rounds by the time they were successful. In fact, to the point where they gave up. And then a friend of them told them, oh, you can go. They did it somewhere in South America. You can go and try in South America. I was in this clinic and so on. And he talked about that whole experience, the stress that comes with not having a child, trying to have one and not having one. And so that is part of the debunking of those myths and making it normal. That, yeah, you can be a high-profile professional, etc., but you can have that as a challenge. And it is not completely unknown. It's not something that you can't talk about. It is okay. In conclusion, if our media stories are told well, and communities understand and can take action against stigmatizing infertility, gender-based violence, female genital mutilation, girls' education, any other social issue. If we tell our stories well, it's going to be a walk in the park for Merck Foundation. Engage communities in dialogue on social issues and capture their voice. Put a face to social issues and the perspective can change. The perspective can change because they can identify with the person who you have profiled or the image that you have painted. The media or the journalists can empower. The pen that you use is a very serious tool. It influences people's opinions on subjects. It changes people. By the way, how many people were washing their hands during the COVID pandemic? Put up your hands. Oh, there's only one at the back. I asked a clear question. Who washed their hands? Put up your hands. Okay, there's some lady there who didn't wash her hands. Everybody. Who told you to wash your hands? World Health Organization, right? Oh, the media and everybody washed their hands. Think back. What happened? One of the things that really took me by surprise is that at every little corner, on the street, in the market, where they are selling fruit on the ground, they put their fruit. We are local guys. We put our tomatoes, oranges, potatoes on the ground. And then they had this small bucket here to say, wash your hands. So you wash your hands, you come and choose your fruits and your vegetables, put them in the basket. That came through the media. What makes you think that we cannot overcome if we go this way? We are the people who can do it. So I want you to interact with this young person. You know him? You know him? Yeah. He's called Questions. Meanwhile, thank you very much for your time.
Thank you, Ms. Christine. I would also like to encourage you all to please share your entries for our media awards. I'm sure most of you all are aware of our media awards, so please do share your entries. Do remember the deadline you can have the boards here as well. You can read the details about the entries out here. Please do remember that the deadline for our lifestyle awards is 30th October. And for our Merck Foundation, More Than a Mother, our 30th September. Now, we would like to proceed for the panel discussion. We will play the song Sugar Free Jude for all of you all. Can we please play the song?
Merck Foundation. No more diabetes, reverse diabetes, goodbye diabetes. We can make it work, we can make it work, we can make it work, we can make it work. Push back diabetes, no more diabetes, reverse it. We can make it work, we can make it work, we can make it work, we can make it work. Can do anything we put the mind to. The body exercise and quit the smoking. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. At our churches every day will make the difference. Exercise every day to make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. And quit the smoking. No more alcohol, no. Exercise every day. This fight is global. This enemy is vicious, but we can defeat it. If we make the choice, we can make it work. If we make the choice, we can make it work. Can do anything we put the mind to. The body exercise and quit the smoking. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. At our churches every day will make the difference. Exercise every day to make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. And quit the smoking. No more alcohol, no. Exercise every day.
Thank you all. We will now proceed for the panel discussion. The topic for the panel discussion is how can media be a creative and honest tool to address our sensitive and critical social and health issues on a daily basis. Let us welcome the panelists for the day. Mr. Pedro Miguel, Deputy Secretary General, Angolan Journalist Union from Angola. Mr. Iso Bolata Roland, President, Association de Asian de Serbs. Excuse me for my pronunciation because it's French. From Democratic Republic of the Congo. Mr. Wisdom Chimwede, President, Media Council of Malawi. Ms. Fatima Capri, Vice Chair, Media Trust of Mauritius. Mr. John Lokabili, Managing Editor, Defi Media from Mauritius. Mr. Samuel Lukinda, President, Zambia Union of Journalists. Mr. Jabolo Cube, Director, Zimbabwe National Editors Forum from Zimbabwe. Thank you all. We can now begin with the panel discussion.
Boa tarde a todos e a todas. É uma alegria voltar aqui. Por isso, agradecer à Fundação Merck por nos proporcionar mais uma vez a oportunidade de partilhar conhecimentos sobre o papel dos mídias como ferramenta criativa e essencial na abordagem das questões sociais e sensíveis em matéria de saúde pública, na consciencialização das comunidades quanto ao seu bem-estar social e mudança de comportamentos relativamente estáveis, o que por si só influencia na alteração dos processos de desenvolvimento humano. A nós foi colocado uma questão: como os mídias podem ser ferramentas criativas na abordagem das questões sociais de saúde sensíveis e críticas. Muitas das coisas que aqui vou me referir já foram ditas, aliás, pelos médicos e, sobretudo, pela última colega que saiu daqui, focou muitas coisas. Provavelmente que eu vou apenas repetir, talvez para ajudar a consolidar o que já foi dito. Olhando para os mídias tradicionais, aqui precisamos distribuir aqui o que são os mídias tradicionais e aquelas mídias que são alternativas. Então, nós nos encontramos naquilo que são os mídias tradicionais, como o jornal, as revistas, rádio e televisão, transparecem, assim, numa primeira vista, transparecem um sentimento de desprezo pelas questões sociais, primando por uma agenda informativa bastante governamentais, em detrimento das necessidades informativas e formativas da população através das mídias. Eu trago isto como experiência do meu país. Por vezes, as nossas comunidades não aparecem nos mídias. Os seus problemas não são falados, não são prioridades. Prima-se para aquilo que é uma agenda estatal. Então, daí que nós temos estado a refletir sobre a necessidade do surgimento das rádios comunitárias. Aliás, as rádios comunitárias já é uma discussão que já vem há bastante, já desde a declaração de Windhoek, que se orientou à implementação das rádios comunitárias. Nós, Angola, ainda não temos as rádios comunitárias. Daí a necessidade de falarmos sempre sobre a necessidade do surgimento das rádios comunitárias, porque entendemos nós que através das rádios comunitárias a mensagem do povo vai fluir. Pois as rádios comunitárias apresentam como uma alternativa e deve ser vista e entendida como um novo e moderno tantã que através delas, sem tabus, discutiriam e resolveriam, entre muitos problemas, a organização comunitária, a educação ambiental, a educação axiológica, que trata dos valores, dos costumes, da cultura, enfim, e a questão da educação sexual. As questões referentes à saúde, como os problemas da infertilidade, o HIV, gravidezes precoces, casamentos infantis de meninas e a questão da mutilação genital, que não se verifica muito no nosso país. Mas como estamos aqui a falar para a África e para a Ásia, provavelmente em muitos países africanos ainda se faz a mutilação genital. Na ausência das rádios comunitárias, o caso de Angola, a mídia tradicional empreende dentro da grelha da programação diária temáticas sobre a educação para a saúde e bem-estar, mas que não é suficiente. Neste quesito, temos a destacar a Rádio Ngolayeto. A Rádio Ngolayeto é do grupo Radiodifusão Nacional de Angola. Esta rádio está voltada para as comunidades e transmite em línguas locais. A Rádio Ngolayeto transmite em 14 línguas locais, 24 sobre 24 horas. Os conteúdos, apesar, tem alguns conteúdos, como conteúdos econômicos, políticos, culturais, e possui uma redação que cuida das questões. Foi criada uma redação que cuida das questões relevantes à saúde, que é a redação social. E nesse espaço de saúde, que sai todas as quartas-feiras, tratam de questões ligadas à saúde reprodutiva, HIV, as doenças cardiovasculares e respiratórias, tornando-se no maior parceiro nas campanhas de vacinação com vista a sensibilizar as comunidades sobre a utilidade e a pertinência das vacinas. Então, aqui, a parte das rádios comunitárias, deve-se aproveitar ao máximo também as novas tecnologias e tudo quanto essas tecnologias nos oferecem. Com o surgimento da internet e consigo as redes sociais, com certeza constituem uma ferramenta considerável, pois contribui na melhoria das condições formativas humanas em matéria de saúde e das questões sociais sensíveis, o caso da LGBT. Ultimamente, temos estado a discutir bastante, não se sabe por que razão, mas que veio muita gente, provavelmente pela globalização, e se levantou muito esses problemas de LGBT, porque já temos comunidades de LGBT a nível de Angola. Então, precisamos falar. Nas nossas comunidades tradicionais, ainda é um tabu. Em relação a algumas doenças, como a hipertensão arterial e a infertilidade, no que toca à informação sobre as causas, consequências e o modo de prevenção, passaria também na elaboração de um fluxograma com pequenos textos ilustrativos. As rádios e as estações televisivas, na sua grelha de programas de programação, deveriam criar textos, ou devem criar textos. Eu temos estado a tentar fazer, influenciando também com a iniciativa aqui da Merck Foundation, temos estado agora também a desenvolver alguns programas ligados mesmo a esses assuntos. E como se não bastasse, nesses espaços de rádio e de televisão, procura-se trazer de uma forma muito lúdica, porque se atrai mais as teledramatologias. Temos as histórias, as radionovelas e, por vezes também a criação de bandas desenhadas nas revistas, enfim. Há um outro aspecto, e a doutora que me antecedeu falou e muitíssimo bem, a questão da língua. Para esses espaços é bom que se faça a partir da língua da comunidade, pois ela consegue atingir as comunidades mais recônditas do país que não se comunicam na língua oficial portuguesa. Hoje, assistimos de forma sistemática à criação de blogs. Isso também é um outro aspecto. Blogs e podcasts individuais de jornais, ricos em conteúdos culturais, econômicos, políticos, desportivos, e quase ou nada se refere aos problemas ligados à saúde. Daí que temos estado agora também a fazer uma campanha para que nesses blogs e nos podcasts, esses jornalistas, se for possível, passarem também alguns extratos, alguns trechos nas línguas das comunidades onde eles pertencem. Porque nós entendemos que as questões ligadas são também problemas nossos e não apenas aos profissionais de saúde. Thank you.
Thank you so much, Pedro. Thank you so much. You also mentioned about creating stories, dramas. So I want to ask you that you saw during the 2 days of our program, we already have a lot of songs that communicate important messages. You already know we have animation storybooks as well. So do you think that the channels in Angola, including the radio stations and the TV stations, you can help us reach to the people of Angola through these channels by playing these important animation stories, films and songs, because we already have them in Portuguese language?
Bom, isso passaria necessariamente por tradução desses conteúdos. Nós temos na Rádio Ngolayeto uma secção também de tradutologia, quer dizer, traduz os textos que estão em português, ou em francês, ou em inglês, para as línguas das comunidades. São 14 línguas, e essas 14 línguas, se nós conseguirmos trazer esses sketches para essas comunidades, com certeza absoluta que nós vamos fazer bem o nosso trabalho, que é de sensibilizar para que as pessoas possam tomar conhecimento dos problemas que vivem, das doenças, como preveni-las, etc.
Thank you. Thank you so much. Okay, now we have our very special partner, Mr. Roland Balota Eso. When I say special, because all of you are special because we have been working together from a very long time. Last year, when you guys came, it was the first year of association. But now this year, we have done a lot in the past year. We've reached out to the community through your help, reached out to the media community through your help. So your turn, please.
Je vous remercie. Merci à toute l'assistance. Il nous a été demandé d'aborder pratiquement le même thème. Comment les médias peuvent-ils être un outil créatif et honnête pour aborder quotidiennement nos problèmes sociaux et sanitaires sensibles et critiques? D'entrée de jeu, nous devons avouer qu'au regard de certains facteurs politiques et culturels et socio-économiques qui constituent l'environnement dans lequel le média évolue en Afrique et particulièrement chez moi en République démocratique du Congo, il n'est pas du tout aisé d'aborder ce thème assez complexe. Sans être un obstacle, cela nous pousse au contraire à approfondir nos analyses pour proposer des éléments de réponse à cette problématique qui se pose devant nous, comme on le dit en allemand, un Dasein, un problème qui est jeté devant moi, dont je dois absolument trouver une solution. Mais avant toute chose, permettez-moi d'abord de clarifier certains concepts contenus dans notre thème. Il s'agit de médias honnêtes, problèmes sociaux et sanitaires sensibles et critiques. Par médias, il faut entendre simplement la trilogie moyens techniques et supports de diffusion massive de l'information. Avec l'évolution des nouvelles technologies de l'information et de la communication, on parle aujourd'hui de médias traditionnels et de médias sociaux. Notons en passant que la télévision, le cinéma, la presse écrite, l'affichage, etc. font partie de médias traditionnels. Les médias sociaux sont ceux qui désignent une variété d'applications web ou mobiles qui stimulent la création de communautés virtuelles par les biais de la diffusion et du partage de différentes formes de contenus. Et ces contenus peuvent être les informations, les idées, les photos, les vidéos et également les articles de presse. À la place du concept honnête, nous pensons qu'il serait mieux de parler d'objectivité. Un défi lancé à tous les médias du monde. On dirait donc comment les médias peuvent-ils être un outil créatif et objectif. Concernant les problèmes sociaux et sanitaires sensibles et critiques, nous nous permettons de citer l'éducation des filles, certaines maladies endémiques, le mariage des adolescents, l'infertilité dans les couples mariés, etc. Maintenant que le décor vient d'être planté, il ne nous reste qu'à répondre à notre problématique. Qu'à cela, nous proposons 5 éléments principaux que tous les médias traditionnels ou sociaux sont appelés à considérer pour répondre aisément à notre question fondamentale. Excusez-moi de tourner la page. Le premier élément, c'est insister sur le rôle de former que les médias sont appelés à remplir. Nous savons tous que le média existe pour informer, former et divertir. Le constat général aujourd'hui est que beaucoup de médias s'illustre plus dans d'autres programmes que dans ceux qui visent vraiment la formation. Il est donc question d'établir un certain équilibre dans le rôle de médias. Je voudrais citer l'exemple de mon pays parce qu'aujourd'hui, c'est tout le monde qui a accès aux médias. Et concernant le programme de médias, les professionnels n'ont plus tellement de place parce que les programmes sont vendus pour la plupart aux paramédicaux et également aux pasteurs. Et ce qui fait que chacun a sa trilogie et sa déontologie et a également ses enseignements qu'ils viennent propager à la télévision. Ce qui fait qu'aujourd'hui, avec le mouvement prophétique ou le prophétisme que nous retrouvons dans les spirituels, les pasteurs en mesure aujourd'hui également de prophétiser des cas de sorcellerie que l'on peut retrouver, par exemple, une femme mariée qui souffre de l'infertilité dans son couple. Mais également, on retrouve aussi des enfants qui se retrouvent dans les cas cités comme des sorciers. Et cela devient un sérieux problème dans la société. Vous retrouvez de paramédicaux, pour la plupart, achètent de programmes télé et comme conséquence, des gens qui viennent vous étaler de symptômes de maladie et qui disent qu'ils sont en mesure de guérir cette maladie. L'infertilité, ils peuvent le guérir, ils peuvent guérir même le sida. Et ça attire un engouement de personnes qui viennent vers eux, et cela au détriment du véritable enseignement ou de la véritable trilogie qu'il faudrait apporter justement à la masse. Et ça crée directement un défaut parce que les médias n'ont pas de moyens et ils se livrent soit à accepter le monnayage de programmes. Deuxième élément, la formation de communicateurs de médias. Les médias ne peuvent être un outil créatif et objectif tant que les communicateurs ne sont pas formés. La formation des utilisateurs de médias prédispose le média à répondre à notre question d'étude. De la première année à l'université, le rôle d'un journaliste formé, d'un communicateur, a toujours été illustré par mon professeur que j'aimerais citer, Moussoko Abombé, par le journaliste est considéré comme la mère oiseau qui, avant tout, prédigère la nourriture et la sert à ce petit sous forme de bouillie. Donc, il est donc important aujourd'hui que celui qui est formé, qui a la maîtrise et le maniement des instruments de médias, peut facilement aborder une question. Je crois que ma consoeur qui m'a précédé tout à l'heure du Kenya, la professeure, elle a donné en subtilité des exemples aussi costauds qui pourront nous aider à aller dans le même sens. Troisième élément, briser certains tabous et barrières culturelles. Point de besoin de vous démontrer comment certains traits culturels enferment le média, surtout dans notre continent, en Afrique, dans un carcan qui, pour ne pas répondre à certains problèmes sociaux et sanitaires sensibles et critiques. Nous émettons ici le vœu de voir le média se libérer des contraintes culturelles pour répondre comme il se doit aux problèmes sociaux et sanitaires. Là encore, c'est un problème culturel. Nos origines. On ne peut allumer une lampe et la mettre sous la table. Lorsqu'on allume une lampe, on doit la mettre sur la table pour éclairer tout le monde. J'invite donc le confrère journaliste. Nous sommes une lampe et nous devons éclairer le monde. Faisons notre travail. Je vous remercie.
Thank you so much, Mr. Iso. My one humble request that I have from all our panelists to please stick to the time limit of 7 to 8 minutes. This is only because we would want to hear you more, but this is only because there's a time limit with the hall here. And now I welcome Mr. Wisdom from Malawi, our long-term partner again. I also thank you, Mr. Wisdom, for helping us with some of the visas here. The attendance here, as you see, would have been doubled if all the visas were issued, but unfortunately, I'm sure you all will go back and share with your friends and colleagues about the experiences that you're going to have here.
Thank you so much for the opportunity to share my views. I would want to begin from the fact that the scientists that have spoken to us, 4 of them have taken us quite into some in-depth science around the subjects that have brought us here. And then Dr. Abalia, Christine, and the 2 colleagues that have spoken before me, I thought already delved into the key question that we were called on to address. That's how creative we can be. And I was thinking that I would rather tweak the question to how we have failed to be creative, because the how creative, I think, has been sufficiently answered to a good level. And therefore, I would want to focus on 4 aspects. The first one is the media's overemphasis on the phrase general public. And then I will come to the issue of the overemphasis of the media as them being jacks of all trades and experts of none. And then I would want to get to the question of imitation and end up with the need of being succinct in how we give out that message to the audiences that we do serve. So you will, as I mentioned, have already gotten the way I've gotten it, that there are so many ways how we can be very creative in ensuring that we are telling these sensitive issues to our audiences in ways that will communicate various messages. But I would want to put it out there that one thing that has failed that creativity over time, and this has been the general problem of the general media, is that we have overemphasized on putting our message to the general public, as if there was something called general public out there. I argue that there is nothing called general public. I think Dr. Abalia put it so succinctly to the fact that we really need to get deliberate. Because whereas we're looking at that village and thinking in that village, there is an animal called general public, there is in there somebody who has just gotten married 2 months ago, somebody who has been in marriage 12 years, somebody who has 15 children. You cannot bundle them into one basket called general public. And immediately our messaging in the media is talking to all these as though they were one, we miss. So we ending up throwing stray bullets and thinking as the media, we are communicating, when in effect, we are not talking to anyone. When we get into the newsroom, you know, the biggest challenge that we do have as journalists is that everybody seems to be clapping for that which we are doing, because then it's me on radio, it's my byline in the newspaper. In the end, this has gotten us to the specific corner where we look at ourselves as jacks of all trades, forgetting indeed that we are experts of none. And the challenge, though, has been also that when we remember that we are experts of none and then get to talk to scientists, we forget that we must be speaking to specific audiences and begin imitating what the scientists are telling us. In the end, again, speaking to nobody out there. I'll give a very simple example. when I'll give a court reporting kind of situation. So you will have this reporter on radio telling a story, a court story, and he says ABCD is in court because he was arrested for doing ABCD, which is contrary to section ABCD of the penal code. And you're telling this story to a villager who has never dreamt of a penal code. Are you sure you have told them of what that you wanted to communicate is indeed about? So 20 billion shillings has been stolen at the Reserve Bank of Kenya. And it's my grandmother listening to that story in the village. What the hell is 20 billion shillings? She's never dreamt of it. But when we tell her that the 20 billion shillings that have been stolen is equal to 50 years of diabetes medicines for you, the story begins speaking to their need state. That, I think, over the years, is one thing that as a media, we have failed to tell. And I think that there is one last point that I would want to think that as media, we need to begin learning from. I like the way South African advertising agents create television adverts. I think they tell their stories in ways that will be as memorable forever as they would communicate that which they want to communicate. One good example is a Kia Sportage advert. So Kia Sportage 2015, there was this guy cruising in a Kia Sportage on a high street. And then there is a police helicopter hovering over him. There is another police vehicle cruising behind him. So he's beginning to wonder, what wrong have I done? I'm only driving a Kia Sportage. So, okay, knowing police, so he pulls over. When he pulls over, that helicopter lands in front of him and the police vehicle stops behind him. The policeman alights on the Kia Sportage, and then he reaches out to his wireless message and he shows a thumbs up to the driver, speaks to his friend, John, you were right. It is Kia Sportage. Thank you so much.
That was really funny. Made us crack. Okay, can I have the person from the technical team to please switch on the projector for our next panelist, Mr. Jean-Luc from Mauritius.
Thank you, Mahak. Well, a lot has been said by my friends and speakers before us. I would put emphasis on two or three aspects of what can be done by media people. Maybe one word has been said by Christine several times earlier, demystifies. I don't know if you realize this word has been stated 4 times, demystifies. And I will try to demystify something about Mauritius. Who knows in the room about Mauritius? What images pops up in your mind when I talk about Mauritius? Can someone? Palm trees, yes. Holidays, luxurious holidays, yes.
The only one that comes to me is that we beat your team.
Oh, it's the only time. Well, you'll see something. Let's say this demystifies the myths, and I would like to show you one video because we have been talking about the ways to be impactful on society, ways to address our stories, and how to interest people about what media have to focus now. If I will move because of the yeah.
Voiture, 4x4, un véritable balai de véhicules, des allers-retours incessants qui dérangent parfois le voisinage. Des acheteurs qui viennent d'ailleurs pour s'approvisionner, on les compte par centaines, au quotidien, la même scène. Ces images montrent un trafic à ciel ouvert au détour d'une rue. Hommes, femmes, jeunes et vieux attendent leur tour pour récupérer leur dose. Les guetteurs sont peu alliés au coin de cette rue. À moto ou à vélo, ils suivent les véhicules suspects pour savoir si les intrus ont pénétré la zone. Des voisins interrogés ne cachent pas leur agacement devant ce qui est devenu une nuisance sonore. Des voix, des cris, des bruits de moteur à n'importe quel moment de la journée. Les rares véhicules de police qui passent font fuir les acheteurs, tout comme ce drone dans le ciel au-dessus de la zone de vente qui pousse ceux présents à prendre la poudre des sans-paix. Alors que le chef du gouvernement lance sa campagne de sensibilisation, les travailleurs sociaux donnent l'alerte. Le trafic est plus qu'alarmant dans les régions périphériques de Bordeaux.
This video talks about drug problem in Mauritius. We as journalists, we know what's happening right now. We know the situation. But some weeks back, the Prime Minister started a campaign, a national campaign for drugs. And he was saying that we are fighting the drugs. This region is a peripheral region of Port Louis, a suburb of Port Louis, where the police can't have access sometimes. Those people living over there always complain about the noise, 24/7 people coming to buy drugs, and the synthetic drug for youth from this region. And someone called to the newsroom and said, I have a drone video showing the situation. We asked to see the video, and it was very impressive. I live maybe 5 to 10 minutes from this region. I never saw that on my daily way to the office. 500 persons waiting for their drugs, 500 persons daily queuing up to buy their dose of drug. And in the meantime, the Prime Minister launches this sensation campaign. And we said it was something that we should show to our viewers. This video was broadcast in our news bulletin at night. You realize the government changes completely the campaign the following day. There was press conferences from NGOs following this diffusion because this was going on for days and days and months and years. No one was taking attention to what was happening. This drone video showed a focus on this region, and the day after, several policemen, hundreds, went there to destroy the stalls where they used to sell the drugs and everything. It was just a show. And the day after this police raid, everything starts again. Just to show you that there's a big campaign launched by the government which recovers, and we have been able to put emphasis on the fact that there is this kind of issues that is not addressed. The power of video. Today in my news organization, we have a paper, we have a website, we have the socials, and we have also a web TV. We can say that the power of images, videos is very, very important in Mauritius right now. We think in our newsroom, it's about video first. We think always video and then for other platform. This video has been viewed 750,000 times. For Mauritius, with a population of 1.2 million inhabitants, 750 is quite significant. And I think from this video, we have been doing a lot of things going in the same way, that is video first, and to help people more understanding. Christina talked about washing hands earlier during the COVID. A doctor, Sunil Ganesh, who is a cardiologist, made a video of 1 minute 30 on our website, showing people how to wash hands during the COVID-19. because we have tendency to open the tap, put our hand and just put the soap and then wash and it's okay. He showed us how to do that and how to clean our mobile phone, because COVID-19 was also present on the mobile phone if it is, if we give it to someone else. This video reached 1 million person. It's a doctor. Sometimes the words or the expression or things that doctors do said on radio or even on television, it's something that people don't pay attention to. But this video helped people to, it is very simple things, but we realize how much it was important for our situation from the COVID, because we had a lot of death. The death toll was high in Mauritius for the COVID, and how this has changed the way people used to wash their hands. It was so important for us. In my news organization, I work for web TV and the radio. We realized that we should help people because people want to visualize things today. They want to see. They no longer want to read because the readership of newspapers are down, like in every African countries and the continents and in the world. But they want to see. And the first thing they do in the morning when we open our eyes, it's not fixing on the clock. It's to see which if someone sends us a message on WhatsApp or on Facebook, on Messenger, or on TikTok or on Instagram, and to watch what have we received as videos in our social platforms. Therefore, it's important to focus on this kind of videos, I think, to grasp the attention of people, of our audience. One more thing I would like to add. Everyone knows the campaign. You remember the Ice Bucket campaign? You know the Ice Bucket campaign, which was sometimes back on the socials. Someone who have an ice bucket and just throw the ice on him. And it was something which raised awareness for medical purposes and raised a lot of money. I think today, information is not about only reading something on the paper or showing a press conference or covers a story. It's about creativity. I think we need a lot of creativity right now because people don't want to read, people don't want to listen, they want to see things. And this gives us opportunity to have a lot of creative facts, giving videos, creative videos and creative campaigns. We have this type of campaigns. We have also, I don't know if you remember sometimes back also, the Me Too campaign, on the socials. This also has been impactful on the society because it's a campaign which was worldwide and people used to follow the trend and have this kind of campaign. I think for health issues, we can use this kind of campaign to raise awareness and to grasp the attention of people. When we talk about campaigning, when we talk about information on the web, there's also the risk of misinformation, which earlier we were talking about. But I think we have to choose a good resource person. We have to, I think, on the continent here, we have met a lot of doctors, a lot of people having good information to share. The networking is very important. We can have resources, a person from Merck Foundation, and also, I'm sure in your country you have people who are really good in their field and which can share information. And don't forget to think about video first, because I think today people want to visualize, want to see things. Young people don't read. They don't read the newspaper. They read only caption on the socials. And if we have their attention through videos and all kind of campaigns, I think it would be important for us to have those kind of campaigns to grasp attention and therefore to sensitize about health issues. Thank you.
Thank you, Jean-Luc. You very well said. And I don't know whether to be sad about it or to be happy that young people do not read anymore. They only want to see. Okay, with that note, I invite our next panelist, Ms. Fatima Kaperi, again from Mauritius, to please talk about the same issue.
Thank you, Mehak. Hi, everyone. I'll talk in French if you don't mind. Yeah. Okay. Donc, bonjour, je suis Fatima Kaperi de Media Trust. C'est une organisation locale financée par le gouvernement. On a un budget annuel pour la formation. On est mandaté pour faire de la formation aux journalistes principalement. Donc, on a une belle collaboration avec Merck Foundation, où justement, on fait la liaison entre les journalistes et les professionnels. Avec Merck, c'est les professionnels de la santé, mais en général, on fait des formations pour tous les secteurs, finances, climat, etc. Et pour la santé, plus précisément, ce qui est intéressant, c'est de mettre des journalistes en lien avec des spécialistes qui, en général, ne sont pas vraiment accessibles. Ils sont souvent très occupés, pas le temps pour les interviews, ou à chaque fois, ils refusent les interviews par faute de temps. La plupart du temps, mais à ce moment-là, à travers une formation, on arrive à mettre ces spécialistes en lien avec les journalistes et l'idée est d'avoir les informations qui ne sont pas facilement accessibles. Souvent, ce sont les chiffres. On peut aller plutôt de diabète. Le diabète à Maurice est un vrai fléau. Nous avons dans chaque famille, nous avons au moins 1 à 2 personnes qui est diabétique. Donc, ça devient un vrai problème national chez nous. Du coup, il y a pas mal de campagnes qui est fait, mais on n'a pas assez de chiffres. Par rapport aux amputations à Maurice, il y a une intervention plutôt qui parlait du diabète. Le médecin au début parlait du diabète et justement de l'amputation. À Maurice, nous avons 600 amputations par an. Pour une population de 1 million de personnes, c'est énorme. 600 amputations chaque année est liée directement au diabète. Donc, je pense à travers nos formations, on arrive à dévoiler ces chiffres qui existent. Les chiffres sont là, mais quelque part sur un site du ministère de la Santé, caché entre d'autres chiffres dans les rapports qui sortent. Donc, vraiment, on estime qu'à travers les formations, on arrive à faire ressortir les informations les plus importantes. Ça, c'est une chose. Et en deuxième partie, j'aimerais parler de social responsibility. Donc, comment est-ce que les journaux peuvent avoir la responsabilité sociale? Je suis également journaliste. On a lancé, il y a 6 ans, on a lancé un site web. C'était le premier site web entièrement dédié à la santé et au bien-être. C'est défisanté.mu. Ça, c'était une première. Donc, on s'attendait, dès le lancement de ce site, on s'attendait à ce que ce soit vraiment un succès. Mais malheureusement, à Maurice, c'est la politique qui vend. C'est les journaux qui parlent de la politique, des scandales. C'est ça qui fait vendre, malheureusement. Je crois que c'est une tendance mondiale, internationale. Donc, du coup, après 1 année d'existence, on a essayé de penser comment faire connaître Défisanté, comment vulgariser le site, comment emmener les gens à s'informer davantage sur les problèmes de santé. Et là, à partir de là, avec des brainstorming, des réunions avec les équipes marketing, on a pensé à une stratégie qui pourrait être faire, je vais vous dire que ça découle d'une idée marketing. Ça a commencé, nous, on pensait dans un premier temps juste pour faire connaître le site. Les gens vont venir, on va partager des pamphlets, on va discuter avec eux pour leur faire savoir qu'il y a justement ce site web. Mais avec l'engouement des gens qui sont venus pour se faire dépister, on avait des médecins, on avait des dépistages de diabète, d'hypertension, de cholestérol, on avait des cardiologues pour les tests cardiaques. Et là, on a vu qu'il y a un vrai engouement pour les examens de santé. Et en même temps, cela amène un positive change. On voyait qu'à travers ces événements, les gens voulaient mieux prendre soin de leur santé. Et là, c'est à partir de là qu'on a pensé que, justement, on peut avoir un impact positif sur la vie des gens. Et l'intérêt est là. Les gens veulent prendre soin de leur santé, mais nous, on leur donne une plateforme pour le faire. Donc, à travers nos articles, au lieu de dire go test yourself, on le change, on le dit comme test yourself at our place. Donc, on invite les médecins, donc en toute honnêteté, cela découle d'une démarche de marketing parce que à la base, les cliniques, les centres de santé doivent payer pour participer à l'événement, mais en échange, il y a toute la visibilité. Parce que avec Jean-Luc Émile, nous formons partie d'une media house where we have web TV, website, radio and newspaper. Donc, nous avons vraiment toutes les plateformes nécessaires pour faire écho de tous nos événements. Et c'est là que vraiment ça a pris de l'essor. Et finalement, c'est devenu notre responsabilité sociale. On fait aussi dans le social, on fait aussi dans le health awareness. Donc, 6 ans de cela, on a commencé avec une première édition et là, on enchaîne. Notre prochaine édition, ce sera la 7e édition cette année, en novembre, le mois prochain, où justement, on met l'accent sur le diabète. Ce sera le 14 novembre. On va mettre l'accent sur le diabète avec des dépistages gratuits. Mais au-delà du dépistage, on a réalisé qu'il ne faut pas s'arrêter au dépistage. On est arrivé à 200 000, 300 000 patients diabétiques. But what next? Qu'est-ce qu'on fait avec ces personnes-là? Donc là, on a commencé à faire une campagne sur la gestion de la maladie. Comment on vit avec le diabète? Comprendre la maladie. C'est pas juste prendre un médicament pour baisser le sucre dans son sang. C'est comment vivre avec la maladie au quotidien. Pas juste quoi manger, qu'est-ce qu'il faut manger ou pas manger, mais comment cet aliment réagit dans le corps. Donc, on est vraiment dans tout ce qui est éducationnel, sensibilisation et accompagnement parce que finalement, on invite les gens à venir prendre soin de leur santé. Je pense que au-delà d'informer, je pense que la presse est en train les médias en général, il y a un chiffre à ce niveau-là où on devient vraiment, on accompagne les gens vers un changement positif. Voilà, c'est tout pour moi. Merci beaucoup.
Thank you. I would like to invite the next panelist, Mr. Samuel Lukhanda from President Union of Journalists.
Good evening, ladies and gentlemen. My name is Samuel Lukhanda. I'm from Zambia. I'm the president for the Zambia Union of Journalists. And if you are the ninth speaker of the day, literally everything you wanted to say has been taken out of your mouth. But I think you all agree with me today that we're all playing catch up to social media. The traditional media houses are on the verge of collapse because of social media. And that's where the distortion about what's supposed to be transmitted starts. We should be responsible by being ethical in addressing these issues. We should avoid sensationalism. Was it professor or the doc that talked about behind that story, there's a person. Behind that news, there's a family. We should not throw them under the bus or for the likes or for the scoop. Ethics should be the bedrock of our reporting. We, as traditional media, I'm thinking most of us here come from traditional media houses. Yes, where when, like Professor said, we toe the line. When you bring in the news, you take it to your editor. But a guy with a camera and a tripod stand in his bedroom will be broadcasting without doing the basics that you do, or without taking the story to the gatekeepers. Okay, so we, as the traditional media houses, have the responsibility to be reporting accurately, to be responsible, so that the people can have a platform where they can go and verify the facts. We should not fall to the fast-paced social media reporting or follow the likes. Lastly, in the interest of time, we should never forget that we should continue setting the agenda, continue influencing policies and discussions concerning health and social issues. Thank you very much.
Thank you, Mr. Samuel. We have the last panelist for the day, Jabulo Q, Director, Zimbabwe National Editors Forum from Zimbabwe.
Thank you very much, Madam Moderator. I think mine is a very, very brief job and the easiest job. And that I have to recognize the doctors, the specialists that were here, and the experts. She was there, and Francisco was there. They actually set the pace for us to say, these are the stories that you should look out for. What is left for us is to innovate creativity. They've spoken about how we should be honest. They mentioned the basic principles of what we should do as we are reporting: accuracy, sensible framing, empathy, sensitivity, raising awareness, highlighting success stories. I got it from you. Responsible use of visuals and collaboration with experts. I mean, we don't have to go back to that. You have given us pointers, what stories to do, what we should do as the media, be it new media, be it legacy media, traditional media, is to be creative. How do you become creative as you want to tell these stories that you want us to do around stigma, GP, and others, child marriages? I think journalism has evolved. Let's agree, all of us. Let's embrace the new types of journalism. I'm talking about the fourth industrial revolution. That will help us to be creative and tell the story in the new ways, unlike our traditional journalism. We also need to maybe that we are here from Kenya, we are an expert in data journalism. Let's innovate around telling the story, harvesting data journalism, because the journalism that most of us know is old. The journalism that is there now is the journalism that we're not taught at universities, at our colleges. The journalism that is being done now is around ICTs. Let's use ICTs to tell our story. That's innovation, that's creativity, that is wanted from us. We know what we're supposed to do, but let's tell our story differently. Let's use our web designing. It's a new type of journalism that we have. I think that's the creativity that we need to do. I like the story, the animation there. That's the kind of innovation that we want. I think with those few words, I think the shortest presentation I've ever done, because my colleagues, it was not deliberate that I'm the last one. We forecast and they said, we'll just talk about creativity. Thank you very much.
Thank you so much, Mr. Juelo, and thank you to all our panelists. And also thank you everyone for being present here. One last thing, we have our medical speakers here who would like to answer any questions that you might have, since we couldn't do the Q&A before. Any questions for Dr. Adam, Dr. Justin, and Dr. Francisca is also here with us. And of course, Professor Siddharth is also here. Yes, we have a question from Nigeria, Bukola.
Good evening, everyone. I'd like to ask a question from Dr. Edwin. Okay, when you were talking, you mentioned hepatitis. Is there a cure for people that are living with hepatitis, and is it possible for them to give birth?
Hepatitis is a viral infection, and normally with viral infections, the body can produce some form of immunity, which will give some level of protection, and it can be a level of protection for a long time. So normally when you test somebody and they are hepatitis positive, you have to check their immunity. And to do that, you check the viral load. That's another test you do. And that test will tell how much of the virus is present in the body. If the viral load is low, it means the person's immunity is high and they are sort of protected. It would not multiply and cause damage. What is the main damage from hepatitis? Inflammation of the liver, which if left untreated and progresses can become primary cancer of the liver. That is the end stage of hepatitis. So the only people that are treated are those who have a high viral load, meaning the virus is not being contained by the person or the patient. And with that, the current treatment is tedious and expensive. You have to take injections, Pegasus, weekly for 48 weeks, which is like 11 months. Very tedious, but that is it if you want to keep it under contain. And you can treat it to the stage where it's like undetectable, meaning that then you are not at risk of passing it on or or it's getting worse, just like is the case currently with HIV. You can take the treatment until the point that they are saying the virus is undetected, and then you can't infect somebody else, and you are also at a good health state. Yeah, so that is it with hepatitis. But if somebody has hepatitis and they're positive, so long as the viral load is low or they are on treatment, then they are not of much risk. When they deliver a baby, the baby is given the 5-in-1 vaccine, which protects the baby against getting the hepatitis, and therefore they can even breastfeed. So it's not a death sentence. It can be managed very well. Yeah.
Thank you, Dr. Adam.
Thank you.
Any more questions? Okay, we have a question from Rosaline from Zimbabwe.
Thank you, Merck. It's for Dr. Ibem too. You spoke of surrogacy.
Yeah.
So I was curious to know how common it has become in Africa, also given the high costs are already associated with IVF. I believe surrogacy is another added cost to the surrogates. What is the uptake like, and do you think it could be the solution to infertile women who can no longer carry a baby, a fetus? Sorry, thank you.
Okay, yeah, surrogacy in our part of the world is like, how can somebody else carry your baby? Sometimes you think of it, which is easier, having a surrogate or using a donor egg. It depends on the circumstances. With a surrogate, the people have their own egg and sperm, but the woman has a condition which will not let her carry, but they want their own genetic child. At that point, the surrogate will carry your true baby for you for the 9 months and give it to you at the end of the 9 months. And it's your own. It will look like you. If they do any genetic test, it's completely you. However, that surrogate must be screened, go through all the necessary processes. And Christine will tell you they need their mental state sorted out properly, because it is very difficult to just carry a baby, you're born with it, feel the movements and everything, and then at the end of the day, just give it out. It's difficult, but there are guidelines to all this. And in fact, the uptake in Ghana, it's very good. If you do it properly, the person must have had a child of their own before you use them. It is easier that way. If it's the first time, it's very, very difficult. And there can be known surrogates. It can be your sister or your niece or something, a very good friend, or it can be a totally unrelated person. The people who are also standing by to use it to the advantage and to the disadvantage of other people. Even IT, all the new things that come in. People are there sponging on it. So yes, surrogacy can seem complicated, but if you have the guidelines and everything and you do the proper screening, it's a very good way of helping some people. Some people, the man and the woman have good eggs, good sperms, but anytime the woman gets pregnant, she miscarries. It gets to the point that you find that maybe somebody should carry that baby for you, and you get your family completed that way. So yeah, it can be useful.
Okay, mine is not a question rather, but just a suggestion.
Okay.
As experts in that field, maybe during such trainings, if you can also be coming up with what's happening in the fertility space in terms of new research, what's happening in terms of treatment, I think it will add more value to the stories that we are supposed to churn out from such trainings. Like, for instance, I didn't know that undergoing cancer treatment can impact on fertility. So something on oncofertility. If we can find new ways, new angles of telling these stories, because we're having very many people undergoing treatment, people in their reproductive ages and would want to have children after treatment, who are not aware that they can do fertility preservation. They undergo treatment without knowing all this.
Yeah.
So I think when we bring about such issues during trainings, they will go a long way in helping us come up with new ways of telling these stories.
Thank you very much. That is one of my passionate areas as well. I think the last Merck session, November in Dubai, I presented something on that. Last month, I was in Athens, in Greece, presented something on oncofertility as part of cryopreservation in the whole of Africa. Next month, I'm in Egypt, giving a talk on that as well. But in the space giving for this, there isn't enough time to touch on everything, but we are happy at any time to provide any information on that. I must say, I thoroughly enjoyed the session today, particularly learned a lot, especially when my colleague from Kenya spoke to the media on how to go about disseminating what they are learning here. I learned a lot from that. And I see why she's heading the media in dissemination in Kenya, and think it's something I must take back home and even help my media people there to propagate that in to the whole media, because having the information is one thing, and how to disseminate it is another thing. And I took shots of what she presented, because it's like the processes you have to go through and all the details of how to disseminate it. And I think it's very good. But I want to leave you all with just this. Who remembers their last birthday? I'm sure everybody here. Yeah. And how did you celebrate? A dinner, a nice meal, a bottle of wine, or whatever. Do you have a license for your vehicle? Almost everybody here would have a car to show that the vehicle is in good shape. Do you have a your own body license? Okay, one thing I recommend and do regularly is before any birthday, that should be a reminder to you that you need to get a good checkup from top to bottom. All the things Dr. Shadat said about blood pressure, diabetic tests, and all that, do them. I do mine twice a year because I say my job is stressful and I can't wait for one whole year before I know what is happening. But like you said, any opportunity of checking my blood pressure, I check it. Many years ago, I've been very sporty, athletic, and all that, and thought, many years ago, that cholesterol hyperlipidemia is for fat people. It's fat people who will have high cholesterol because cholesterol is like fat. So, and I was surprised when I checked mine and it was high-ish. I said, maybe I'm not exercising enough. Let me do some more. I did it. It wasn't going down enough. Maybe I'm not eating enough vegetables. Then I realized that both my parents had it. So it was familial. I had inherited it. It's not because I don't exercise or I don't eat well. So some things you inherit, but it doesn't mean you leave it or ignore it. Why do we treat diseases? It's in order that they do not kill us or they do not give us complications. So one very common thing in our part of the world is people refusing to accept a tag or a stigma that he's diabetic, he's hypertensive, he has high cholesterol, or he's asthmatic. They think it's bad, it's a bad image. It may not be your fault, but then we know people who have those conditions and have excelled because they followed the rules, they checked themselves, they took medications, and they lived long and had no complications. I looked after a set of twins, a male and female, probably 40 years ago. I got some orchids from their home and they talk about their condition. And they've been so particular with their medication that the female died at the age of 92. And I met the man at a function last year, which means he's still growing strong. They never had stroke. And you find a 43-year-old who is hypertensive thinking, oh, why should I take this medication? So please preach it out there. Check yourselves regularly. Don't wait till you are unwell. Rather check so that you will not be unwell. And you can have a good lifestyle and live well and enjoy yourself without complications. Something tells you that your blood pressure is going high. By the time you're getting those symptoms, it is too high. So just check it on a regular basis. And there are medications to manage you. For the men, for a long time, men wouldn't take antihypertensives because it would not give them a good erection. But those are old drugs. There are new ones now you can take and still perform very well. So please check your blood pressure, check your sugar, and do all the MOT or your regular checks to be sure that you are in good health, and don't wait to be brought down before you start. I keep telling people, if you refuse to take your antihypertensive, on the day that you get a stroke, you would wish they would pile all the ones you refuse to take so that you can quickly get back your muscle or your nerves or your power. But it's too late. The damage is caused. You're paralyzed on one side. You can't talk for a long time. So please take your medication. It's easier to take them and remain healthy. If I don't pass on any message at all, at least for ourselves, let's remain healthy and keep disseminating the good work that Merck Foundation is doing. Thank you very much.
Thank you, everybody, for joining us once again.